Am I audible, visible? How are you all? I hope I am audible and visible because we are starting with the exam paper discussion. I hope I'm audible, visible. I can't see myself. Dr. Shivu, kindly see. Please join in. Okay. Yeah, am I audible, visible? Can you make me bigger, Shiv? Make me bigger, okay. Yeah. If possible, just make me focus and remove the chairs. Yeah. We're starting. Oh, just give me a second, okay? Please, 1 second, okay? We're starting the session. Because the faculties have to come, so I'll just waiting for them to come. So I'll be starting the session till then. Ma'am आ गया. So ma'am is here, okay? Just wait a second, okay? Okay, so I'll be starting the session. Yeah, hello to all, okay? चलो, sir is here and ma'am is also here. Come ma'am, आइए. ठीक है, शिबू बी हियर, हेल्प मैम एंड सर कनेक्ट दियर सिस्टम्स. ओके, आप लैपटॉप लोगे ना? आप क्या ले लैपटॉप? ठीक है, तो सर अभी रुक जाओ, अभी मैं थोड़ा सा ले लेता हूँ, देन विल कंटिन्यू. हाँ आप कर लो, ठीक है. तो आई थिंक आई विल स्टार्ट. ठीक है, सो मैम एंड सर आर हियर, सो आई विल डिस्कस. चलो, okay, so let's start the session. Okay, so I hope you all are here. Okay, we are starting it. So 156 people are live. So the result I think will come in next maybe 15-20 days. Okay, so let's hope they give fast. Best if they give in 10 days, but they might take 20 days also. So that is something we don't know. We are not sure what time they will give. Hopefully the result will come soon. Okay, so how are you? Thank you Manish, Dr. Manish Saab. Chalo, so we'll be yeah, starting the session. Okay, so how are you all? How are you? Are you feeling anxious? भाई सारे करा देंगे राकेश मेरे भाई, सबर कर ले. और भी सब्जेक्ट हैं, ओबीजी भी होगा, सर्जरी भी होगा. ठीक है, क्लियर? Yeah, please join in, ask others to join so that we can have a much realistic discussion. चलो, हेलो टू मदर ऑफ ACJ. भाई पूरा नाम तो लिखा करो कम से कम, ताकि इज्जत से बोले. मम्मी क्या बोलेगी, क्या नाम रखता है तू? ACJ. ओके, वेरी बैड कंडीशन. प्लीज डोंट बी इन अ बैड स्टेट. be very happy and motivated, because the questions are going to rock you. If I give you estimate, we have got 120 question till now. Okay, okay, from rapid revision sessions taken by me, Nitin sir, Harmeet ma'am, Shrikant sir, Devesh sir, Paras, Sara. Okay, from rapid revision, chanting, okay, PYQs, faculty session. Okay, and yes, if I take the NLC main notes which they did in the classes, okay, then it can cross. Toshibu, can you close the door? Okay, then it can cross, I think, even 200 plus. So 200 plus questions are there from NLC classes and notes. So I think that is one idea we can have. Okay, yeah. So rapid revision is available in YouTube. Yes, it is there in the rapid revision. Don't feel negative. Clear? Because even if, I'll tell you, you get 100 MCQs right. Even if 100 MCQs are right from today's session, 100, okay? So, or even if you get 50 out of 100, remember, in the remaining 200, even if you have 25% right, 25%, that will give you 50 marks. And what is 100 plus 50? 150 pass. So you are all passing the exam if you can get 100 correct in that session. Okay, so just 100 correct is we need to have, and that is a prerequisite for all of you. Okay, so that is the case. Okay, done. So don't worry at all, and you are all going to rock and do well in this case. Okay, okay. So I'll ask the team to kindly share the link to all the groups so they can all join in and watch it. Okay. So notes etc, they are available here. Rest we can get. Don't be depressed. Okay, whatever you are doing, it's more than sufficient. Okay, you have given your best. It's the time to get motivated for the future, because you are all fighters, and fighters never quit. They're always working hard. Okay, chalo, so I'll be starting the session. Okay, and I'll be starting the session with the subjects, and I'll just give an idea that how well the questions would have been framed. I'll just give you questions, okay, like from the class notes etc. So I'll just start with just a random idea. Like there was this question. Okay, so I hope you all can remember this question. Can you all remember this question? These faculties are different online, offline, because some faculty who are teaching in apps, they cannot teach other online platforms. So yes, obviously there would be some difference in this case. Okay, otherwise all teachers are same. Okay, NLC is in Calicut, not Trivandrum. Thank you very much for your nice comments, Dr. Robin Goel. Thank you, thank you. So this was there. It is, yes, it is the waters. Remember कैसे याद करना है? अगर आपका माउथ खुला हुआ है, you can see maxillary sinuses on both the side plus frontal. This is your waters view. कैसे याद करोगे? How do you drink water? पानी कैसे पीते हैं? ऐसे. तो हल्का सा टिल्ट करते हो, ऐसे पीते पानी, है ना? You drink. So remember, waters view का काम ही क्या है? पानी पीना, जैसे पानी पीते हैं. How you drink water? That is waters view. So this was question asked. Okay, then I'll give you one more example of questions which were there. Okay, the question on a person lost his foot. Loss of organ, anatomical or physiological, is impairment. Can't do work, can't walk, can't sit, can't talk, can't see is disability. And handicap is social and economical. So again this question came, impairment. So this was the impairment one. I hope this question you got right. Impairment question. Impairment. Again, it was there in the notes. I'll show you. Don't worry, with references. Everything is with references. Don't worry. Okay. Then this question came, acute malnutrition. Okay. What are the three criteria? Even pediatrics rapid revision of mine had this question, acute malnutrition. And for stunting, we use what? We use height for AC for stunting. Again, this was covered. Even this necklace question, can you see? So discuss Castle's necklace, niacin deficiency. Again, this question is a repeat question. It was asked in last session. Stunting is height for age. Yeah. 2 standard deviation. Yes, we'll take 2 standard deviation. Okay. So just giving an idea. So if you want, I can just give you the question. See, this question was also there, quali question. So this is again from our Murugan sir. He teach in online batch PSM, very great faculty, and he covered this topic of quali, Hale, Dale, Sullivan, and he discussed it is what? So it's quality. Again, this question came, quality of life, yes. Okay, so quality adjusted life is the opposite of daily, which is disability adjusted life here. Again, this question came in the rapid revision of Murugan sir. So I'll just start with, I think now the medicine questions. Okay, yeah, so you can see even this question came about the which type of bilirubin is seen. So in rotors we see the immature one. Okay, that is it show partial unconjugated. Okay, clear. So HDI question, yes, it was there. So I'll show you, don't worry. So let's start the session. So I'll be starting the session with, let's say, our complete. See, I have two group of questions. One is the complete questions, other like this question. This is a 4-month-old question on the Telegram group about the presence of what? The homogenticide, and there's a black urine. There is a black urine. See, so there is a history of what urine? Black urine. So there is a history of black urine, and this answer was homogenticase oxidase. It is alkaptonuria. So again, is this question there? Was this question there in the exam? Was this question there in the exam? So again, it was covered up in that session. Okay, so it was covered in that session. Yeah, okay, fine. So again, we'll see the questions and we will discuss them. Okay, so let's start. So I'll discuss the medicine questions first. Okay, so let's start the medicine question. This question was asked, okay, narrow QRS complex, and the rate is very high. Okay, how do you know the rate? We calculate with 1500 divided by RR interval, and I discussed that question in the medicine rapid revision that it is a SVT or a PSVT. Okay, because why it is seen in what? Tachycardia. Okay, and in atrial fibrillation the QRS is normal, there is no P wave. Okay, fine. So this I discuss in my medicine rapid revision. You can see this. So it was taken on 1st of June, and I discussed in VT there is an increased heart rate of 100 to 250. So check the QRS. If it's a narrow QRS, it's a SVT or PSVT. If wide, it is ventricular tachycardia. Okay, so heart rate is 250. Again, it's a tachycardia. It's not a fibrillation. Fibrillation is what? 350 plus. So it's a answer is VT. So answer is VT, not anything else. Okay, done. Next question. Patient complains of, this is the second question. Okay, there were two questions. Okay, patient complained of palpitation on examination. Irregular pulse is obtained. Okay, so again I discussed this question first. In this case there is no P wave. In atrial there is no P wave. There is only QRS which is having irregular interval. So that's why if they have no P wave and irregular pulse, you should go for atrial fibrillation. In flutter, the pulse is what? Very much having a regular RR interval. Can you see the distance of RR is fixed? So pulse is having regular rhythm. Okay, fine. Yeah, so it will be atrial fibrillation. Yes, so it will be atrial fibrillation. So this question also I discussed in your medicine rapid revision on 1st of June, and it was there. Yeah, this question was there. Okay, it's not a tachycardia. Why? Because in a tachycardia you will get what? The abnormal QRS complexes. There is no such history. Okay, so rather go for atrial fibrillation. Okay, then punch out lesion, which immunoglobulin will increase? So they give a photo with creatinine increase. This was again a PYQ which was asked like this. A 70-year-old man presents with low backache with increased serum creatinine, and you can see punched out lesion in the skull. That is a classical multiple myeloma appearance. Okay, it's multiple myeloma. And remember, in that multiple myeloma I wrote the same session 1st of June, I wrote that in multiple myeloma there is an increase in gamma globulin. There is an increase in gamma, and urine there is Ben Jones protein. Ben Jones protein. So gamma globulins are increased, okay? And they ask which part of the light chains is the kappa part, but in exam the options were gamma globulin is increased, not alpha, not beta, but gamma. So this was again a exam question. So this will be gamma globulins. Are you clear? So we'll go with gamma globulins. Okay, there's no alpha beta, then this gamma globulin. Van Jones proteins, I told you, they appear in urine when you heat the urine, and they disappear at 70 and then they reappear when you cross 100. So that is called as the Van Jones. I explained that in discussion. So written is obviously only Van Jones, but I explained the theory in my first June rapid revision session. Okay, so this question was there. So two questions we got from multiple myeloma session itself. Next question was there. There's a question of child with edema, proteinuria, some cloudy urine. I could not get the exact question. Some cloudy urine question was there. Again, it's a PYQ in which they gave a dipstick with proteinuria and they were asking. So I told you, if it is Coca-Cola, it's nephritic, but if it's cloudy urine with proteinuria, it's nephrotic syndrome. And nephrotic if child, it is mostly minimal chain disease, will give prednisolone. So we'll give the prednisolone, and if it doesn't respond, we'll go for cyclophosphamide. I discussed that also in the discussion. So this question, the answer would be your yes, prednisolone. If it is resistant to prednisolone, we'll go for cyclophosphamide. Are you clear? So is this question clear to all of you? Right now I'm not going to explain all the options because I'm just going to do a recall session. Very soon we'll publish a proper explanation once we get the options and everything correct. Okay, fine. So I can just give you the answer would have been prednisolone, minimal chain. I discussed the findings. Okay. Next question, there was Parkinson treatment, and Parkinson treatment again I discussed in 1st of June. Some people say sir Parkinson nahi tha, Huntington tha. I discussed that also. If there is an abnormal increase in movement, it will be a Huntington disease. If there is decreased movement rigidity, it's Parkinson disease. And I discussed the treatment in my pharma class also. So pharma rapid revision I took on 26th of May. I discussed all the drugs of Parkinson, what we should give. So drug of choice, the anticholinergic, all the mnemonic I gave, and I discussed all the gelins, everything. So I discussed that. Okay, fine. See, if there's a grimace face with flaccidity, we'll go for myasthenia gravis. Okay, clear? So I don't know the option. That's what I'm saying. We are right now not discussing the question answer because we are not yet sure about the question. We try to get the question, but I'm just discussing. If the treatment of Parkinson, I explain you that for old people we'll go with L-DOPA and carbidopa, and we'll add safinamide, which is a MAO-B inhibitor, or in a gelin. We can also add any of the gelins, seragilin, rasagelin. I discussed that in this case. Clear? If it was not even Huntington, I discussed that in this case. Okay, so even the Huntington I will show you and discuss. Yes, so I have got this also. So if you say sir Huntington, this is also there, because see, this is the Huntington. Can you see that? So damage to GABAergic neuron, it causes dance, it causes the involuntary movement, and that is Huntington disease. So in Huntington, he make dance, chorea, involuntary movement, and jerks. Yeah, jerks are there. So then it might be Huntington disease. Treatment is tetrabenazine. I took that on my medicine class on the YouTube 28th of October. 28th of October, I discussed that. So I don't know what is the case. So I'm just going to collect the option after discussion. Okay, I'll send you the rough PDF. You can add your corrections and we will discuss it there. Okay, chalo. A patient is chronic stable angina with heart failure. What drug will increase longevity? That means decrease the morbidity and mortality. And I told you in heart failure, the best drug to do this, okay, if diagnosis, then it's Huntington. Okay, okay, fine. So they ask which drug will increase the longevity or decrease. Okay, then I discuss again, it was a PYQ which I discussed on the medicine rapid revision, that for heart failure with pulmonary edema will give loop diuretics, but if it's a heart failure, remodeling, and that will reduce mortality and increase the lifespan, and that is ACE inhibitor, which are prill drugs. So prill drugs will increase this. Okay, so the answer would be prill drugs. Are you clear now? So I hope this question is right. So prill drugs will increase. So which was the prill drug in this question? It was lisinopril. So we'll go for option C, lisinopril. Okay. Okay. So please keep giving the options. If anything is wrong, I will adjust to the explanations. Okay. Chalo. Next question, it was about myasthenia gravis, which hypersensitivity. Again, I discussed that in rapid revision also, and I discussed this time in my medicine classes CNS, which I took online also on 30th of October. You can see on YouTube also, and I discussed it is type 2 hypersensitivity. So I discussed it is which hypersensitivity? Type 2. Okay, so type 2 hypersensitivity. So yes, this question was there. Type 2 hypersensitivity question was there. And in myasthenia, one more question was there. He, a 25-year-old male with ptosis worsen in evening and exertion. Remember I told you exertion and evening cause worsening of the flaccid paralysis and improvement in morning. And there is a exertional fatigue. I discussed an ice pack test show relief in ptosis, and I discussed that ice pack test. I discussed that not used nowadays. It applied to eyelids and it caused the increased ACH, improve contraction, and yes, reduces the ptosis. And I discussed that, and also the tensilon test. We give adrophonium. We give adrophonium. Again, this is my medicine notes of myasthenia gravis taken on 30th of October, where I discuss exactly ice pack test. If diurnal rhythm, again the same thing, okay, that the pattern is not same. The ptosis is more in evenings, not morning. Sometimes also called as evening paralysis, evening. So again, it was a myasthenia gravis, okay, and I discussed that in my class notes also. So rapid revision also. So that is a question. It is mostly myasthenia gravis, okay. Amyotropic is spastic paralysis, and it doesn't improve with ice pack test. There's no problem in neuromuscular junction. The problem is in what? Yes, the myelin destruction, okay. So yes, you're right, it's clear, okay. Yeah, ice make ptosis get normal, okay. Chalo. Good, very good. Next, a smoker male who has difficulty swallowing. Once they gave smoker, there is high chance of squamous or small cell cancer. Both are there. Both are related. Sasa are smoker, and this I discuss in my patho revision. See, adeno is gland. It's mainly non-smoker. Female non-smokers. Females, non-smoker, and periphery. So female non-smoker, periphery. Female non-smoker, periphery. And I gave the mnemonic also. Sa, sa, sa. Remember mnemonic? Sa, sa, sa. Sex causes squamous metaplasia and carcinoma. So smoking, sex, stones, they cause squamous metaplasia. And in cervix, it is 16-18 HPV, which causes the, yes, cancer. HPV, you can read. And airway, smoking cause the lung cancer. This was again taken by me in the class. It was my pathology rapid revision. You can see me in the same t-shirt that I took. It is pathology rapid revision. The notes are available in the group. You can check and see. So clear? Okay. So I think it was squamous. Okay. It was given squamous. Okay. Yeah. In hypoglossal nerve injury, which is seen. So hypoglossal is upper motor, lower motor. Guys, what do you say? Hypoglossal will be upper motor or lower motor? See, if they are giving smoking, we should rather go for squamous, okay, rather than adeno, okay. So my question is, hypoglossal is LMN, UMN? LMN, UMN? It is LMN. LMN, okay, because nerve is cut. Nerve injuries are LMN. I discussed that. So it causes the deviation on the same side. Also fasciculations. I discussed that also. Fasciculations. So fasciculations, and there is a same side deviation. Again, I covered it in my lectures. Okay. So which lecture I covered this? It was in my online lecture. Can you see the date? It was 29th of October, which I covered this lecture on YouTube, and I discussed about the spastic paralysis, bulbar palsy. I was discussing bulbar, 12th nerve by movement tongue. It causes the weakness and deviation of the tongue because of genioglossus muscle. Which muscle? Genio. If upper motor, it will be opposite side, and if it is lower motor, LMN, it will be same side. So again, it was there in my this. Okay. Okay. So on protrusion, it goes to the, yes, either same side if it's LMN, opposite side if it is upper motor neuron lesion. Okay. So again, this question I discussed in my classes. So if you attended, you would have known. Then there is hypotension, there is diminished or smooth or some muffled heart sound, and absent Y descent. Absent Y descent is the main hallmark which I discussed in the mnemonic, very famous now. It is Kussmaul mnemonic. So Kusum went to Maul in what? Connaught Place. Remember Connaught Place? with her boyfriend X and Y. So X and Y prominent is small sign, that is constrictive pericarditis. And in cardiac tamponade there is only X prominent. I said agar cut jaye, see CUT cut gaya, X cut gaya, then you should go back. You should not ask why. Why is absent. So I asked this question, why is absent? Okay. Yeah, Madvier will discuss, don't worry. So I'm here to discuss all important question. This was a classical question of CT I discussed and I said, बच्चा question repeat नहीं होते, आप ये चीज समझ लो. Questions are not repeated. The topic, the concepts are repeated. And I said multiple times, JVP changes are important. And I taught this in my regular class also, rapid revision also, same thing. At least 15 MCQ came only from rapid revision of 3 hours. 3 hour rapid revision covered, see 3 hours, covered at least 15 plus MCQ. And I think that is a good strike rate for a 3 hour video. Chanting, rapid revision, they are just 10% of NLC content, but they cover more than 100 MCQs in the exam. So if you are doing regular classes, then chanting, rapid revision, you will get a very good score, at least 180 to 100 plus. But if you're just watching chanting and thinking ki you will solve all the question and then abuse, some people abuse us based on कि सर ये क्या 10 क्वेश्चन आए, 10 क्वेश्चन से कहाँ से पास होंगे. बच्चा, this 10 questions you are getting, 15 are from the 10% of NLC content which you are watching. Watch the entire. ये तो आप फिर गलत बात के लिए आप किसी को मार रहे हो, आपने पूरी बात सुनी नहीं, मारना शुरू कर दिया. So please understand, we are working hard to get this thing. Okay. चलो, next question. Chronic alcoholic. The moment you say chronic alcoholic with liver disease, we should suspect what? Portal hypertension. Your suspicion should be portal hypertension. And if there's a bleeding, it's because of varices. So we will go for bleeding varices. In case of ulcer, there'll be a sharp pain. Okay, clear? Plus in Borhaven, there's again history of what? Some retching, forceful, vomiting, something. And yes, it's no such history. It just say liver disease. So you should go with what? With this. I discussed that also. If they ask what are the most common complication of what? Decompensated cirrhosis, it's portal hypertension. It's portal hypertension, and the varices will cause hematomasis. I discussed that in my online class, rapid revision. Hematomasis will be there. Okay. Then a female is having neck rigidity, so they are having cannot touch neck to chest, that is the neck is rigid, cannot move. Lumbar puncture show gram negative, they said something. Okay, gram negative. Okay, gram negative. See, Mohammed Azaz, if they are giving some history of vomiting, retching, something, then we will go for Mallory Weirs. Okay, so please give me the options, I will include and will discuss. Okay, and CSF pressure is increased, color is cloudy, so we are suspecting. If it is neutrophil, we'll go for bacterial, and sugar is less, normally 60, proteins are more. So classical bacterial. Okay, classical bacterial. If vomiting is there, retching, then we'll go for Mallory Weirs. Okay. Now remember, I told you very classically in my rapid revision what? If there is meningitis, there will be decreased glucose, increased protein. Cobwebs and lymphocyte. Okay, cobweb and lymphocyte are TB. Okay, are TB, and it is ATT we should give. So that's why if lymphocyte they are mentioning, we should go for what? We should go for what? TB. But if they are mentioning neutrophils and even gram stain they are giving, then we should rather go for pyogenic, that is bacterial is the answer. Again the question is, okay, मैंने बताया था ग्लूकोज कम है, शुगर खा गया बैक्टीरिया, एंड प्रोटीन्स बढ़ गए, प्रेशर बढ़ गया. And I discussed that again on first. See, 15 MCQs came only from 1st June session. Okay, 1st June. So the answer for this question, we will again go for bacterial if neutro. If lympho, will go for TB. If lympho, will go for TB. Done. So lympho will go for TB. Okay. Okay. Yeah, history is also given for 3 days. Okay. Next question. Yeah, which of the following is seen on high altitude? This is dizziness, headache, cerebral edema. What is the reason of edema? It's vasoconstriction. So what happens is hypoxia causes vasoconstriction in the brain, and this is the reason for what? Cerebral edema in the sensory sign symptom. So obviously BP is increased, yes, because of high sympathetic. Hemorrhage chance are less because there's a vasoconstriction or dilation. Altered mentation, yes, whenever brain doesn't get the blood flow, it will show the altered mental, that is disoriented in time, place and person. Okay, so that's why we will go for this. Okay, if neutro, yes, we'll go with that. Okay, believer, neutro will go for bacterial. Okay, so it's altered mentation as the best answer. Even in fact, I discussed high altitude sickness in my class. I discussed that person go to Ooty, Manali, you know, mountain sickness, high altitude, there's hypoxic hypoxia, there is CO2 washout, also vasoconstriction is there. I took this class on, yeah, for June exam. Okay, clear? Pharma rapid revision I discussed, and treatment of this was acetazolamide. It is acetazolamide. Okay, see Rahul, Hitesh Kumar, whatever options are changed, please give the options. We are going to work, that's why we are not doing an exact paper recall. That will take time. The PYQs will be developed in time and we will give it and discuss. Okay, chalo. Now ABG report, pH is less and carbon dioxide is more. Bicarb is almost normal. That is why it is uncompensated respiratory acidosis. So this was, all of you got it bang on target. It was respiratory acidosis because of what? High carbon dioxide. There's a 100% rule. High CO2 is respiratory carbon. Okay? So this was all got right. So respiratory acidosis, and this I again discussed in the exam itself. If there is the same session, see 1st June, see 1st June gave 15 plus MCQ, 15 plus in a single session. Okay, so if there is respiratory alkalosis and bicarb, we check. If bicarb is high, it is compensated, normal uncompensated, if low it is mixed. I discussed that. Okay, so it was a PG question also. Clear? So again, this question we are able to solve using PYQs. A family member volunteering for blood donation with a RTA is giving blood which, so obviously HIV1 and 2 spread via blood, HIV also blood, and A is orophycal, so obviously it's not via blood, so you don't have to worry about that. C is again, yes, via blood. So answer would be yes, orophycal, that is C. I discussed that in again my session, that how they are spread. See, A is orophycal, C is chronic, E is pregnancy, again orophycal, and oral chronic is B, and I discussed they are via blood. They are via blood. So I discussed which is blood and sex. So hepatitis B and HIV are for blood and sex. Okay. Yeah. So we will go for this. Okay. So we'll go for hepatitis A. Then a patient has palpitation, episodic headache and sweating. It's a triad of pheochromocytoma, which I discussed already. So pheochromocytoma triad is there. And in the pheochromocytoma triad, we'll check for what two things. One is metanephrin and VMA. So answer is VMA, and I discussed the VMA here, that in case of pheochromocytoma, which is 10% rule, no biopsy, IOC is 24-hour urine metanephrin and VMA level. I discussed VMA, and the best is plasma metanephrin. Best is plasma metanephrin level. Plasma metanephrin. Okay. So clear? So again, that's the case. Then question was GCS of RTA patient. GCS of RTA patient. Okay, clear? So question is, see 3 hours 15 questions, 30 hour 150 pass. यार इससे ज़्यादा easy क्या कराएगा? ठीक है? So GCS of RTA is 10, and I discussed that again in my session CNS part 6. You can watch it on YouTube. It is there, stream live on 30 October, and I discuss here GCS. See, motor 1 no response, D cerebrate, D corticate. There I mentioned 13 to 15 is mild, 9 to 12 is moderate. So 10 will be moderate. I discussed that in this case. Okay. So that's why I'm giving a proof. कोई अगर question, and if I show you how bad people are speaking about us, I'll just show you how much we are getting hatred despite giving all true authentic answer. And this I'll just show you. See what kind of bad things the people are writing about us. See, I'll just show you. See, just I'll show you this comment. Can you see? So someone, we posted the comment and someone says, see, I hope you can all read this. So it's saying it's just waste of time. Clear? Not a question. See, they are all people who are, see, just waste of time. NIC, not even saying NLC. One should not invest a single penny to this. अरे we are teaching free sessions. We are taking free sessions यार. आप कैसे बोल सकते हो हम पैसे लेते हैं आपसे? और उसमें भी देखो किसने लिखा? They do know.
बड़ा दुख लगता है यार, इतनी मेहनत करने के बाद अगर कोई आपको फ्री की चीज को क्या जज करोगे यार आप? मतलब आपको तो हक भी नहीं है कुछ बोलने का, डिस्पाइट ऑफ बीइंग थैंकफुल यू आर अब्यूजिंग अस। ये तो
Yeah.
मतलब कोई बात है, हम डिजर्व
ये
नहीं करते यार।
ये इनको बोला कि आप आके मिलो तो सही, बताओ ना आपको
बिल्कुल
क्या
बिल्कुल।
दिक्कत है। तो कहती है आई नेवर वांट टू मीट यू ऑल, यू वेस्टेड माय टाइम सो मच, सो आई ओपन हर प्रोफाइल एंड दिस इज व्हाट आई कुड सी।
Yeah.
दिस इज द प्रोफाइल। डज शी लुक लाइक अ मेडिको स्टूडेंट?
Yeah.
Is she looking like a medical student? She is posting the video and this is the name videos they are posting and someone said कि माशाअल्लाह भाभी you so cute, who are these two? So Joha Khan, I don't know who you are, okay, but I don't think you are a medical student. This kind of comments I don't think a medico can post, ठीक है? And they said so much bad. She keep, and earlier she used the name beta blocker and harassing us.
Yeah.
कि मतलब she even used bad words, curse word about me and the team. C वाला word बोला। यार आपको किसने हक दिया? ये तो फ्री में आप पढ़ा रहे। देखो ये कितना अच्छा कमेंट है कि थैंक यू, लेंदी था, आपको हेल्प किया। और यहाँ पे ये देखो जी भाई साहब, ये
बड़ा दुख लगा है, बहुत दुख लगा है। जैसे कि इतने ज्यादा एफर्ट, क्या ना, टाइम सबसे बड़ी इन्वेस्टमेंट होती है यार। हम टाइम देते हैं आपको और दिल से देते हैं, उसके बदले में मतलब कोई आके ऐसा लाइव चैट में भी कई बार लोगों ने कोशिश करी क्लास को डिस्टर्ब करने का। वो चाहते नहीं है एक्चुअली तुम लोगों को हेल्प कर पाए। और मतलब क्या ही बोलूं मैं।
ठीक है, सो आई जस्ट फिनिश माय मेडिसिन and then I have a second file with then third file. We will prove with complete evidence 200 plus question from our chanting rapid revision classes. Okay, I'll finish medicine 33 questions. Ma'am, sir will discuss. Then I'll give one more file with show even pediatric, psychiatry, patho, PSM. So that all are prepared. भाई पूरे proof लेके आए उस बार।
And if they have any doubt, na, they can come to us. We are in Delhi NLC all the time available. We will answer each and every question.
ये क्वेश्चन, ये देखो, ये बोटॉक्स रिंकल ये बोटुलिनम टॉक्सिन, ये किसी के नोट्स में नहीं है, किसी के में नहीं है। इट इज देयर इन आवर एनएलसी नोट्स। ओके, सी यू कैन सी प्रूफ। आशीष सर इज टेकिंग द क्लास। लिंक भी दे दूंगा, कोई बोलेगा सर लिंक दो, ये लो भाई, फार्मा रैपिड रिवीजन तारीख है, स्क्रीनशॉट ले लो। रिंकल्स क्वेश्चन आया था एंड व्हाट इज गिवन, बोटुलिनम टॉक्सिन। और नीट पीजी का रिपीट है क्वेश्चन कि हाउ इट एक्ट वाया स्नेयर प्रोटीन। ठीक है, और प्रूफ चाहिए तो ये कोबरा बाइट क्वेश्चन आया था। ठीक है, क्या देंगे इसमें, कोबरा बाइट न्यूरोटॉक्सिन आया था। ठीक है, कार्बन पॉइजनिंग का क्वेश्चन आया था। सो एवरीथिंग इज देयर यार। ठीक है, व्हाट वी गिव इन कार्बन पॉइजनिंग। ओके, हाँ, डायरेक्टली इनडायरेक्टली ऑब्वियसली यू कैन नॉट गेट,
इट इज जस्ट रिलेटेड यार।
या सी दिस क्वेश्चन केम, द contraindication बीटा ब्लॉकर, contraindication बीटा ब्लॉकर क्वेश्चन केम and again they were there. So that's why I am going to give you each and every proof of what we taught and it was there or not. Again, pharma rapid revision 26 में everything is on.
Actually, students forget. ये क्या होता है पता है? We have taught it, it's there, but while you see the paper, you're like कुछ याद आता है, कुछ नहीं आता है, and then you'll be like कुछ नहीं आया इसमें से। तो that is a very big insult. क्यों पता है? Because पारस का सोचो, आशीष सर का सोचो, वी हैव टेकन फ्री क्लासेस। मतलब जब इसका नीट एग्जाम था, ये बैठ के आपको पढ़ा रहा था। वन डे बिफोर दैट ऑल्सो ही वॉज टीचिंग यू, एंड देन इफ यू कम एंड टेल ऑन हिज फेस कि इसमें से कुछ नहीं आया यार।
नोएडा वन गर्ल वाज देयर, है ना? So that girl actually before exam she said thank you sir for your chanting session. Then after the class everyone was praising sir, thank you. That only particular girl came, said kuch nahi aaya.
Yes.
So
it's very hurtful.
You can see the proof. Maybe you are sent by someone. You are some agent. I want to say that time I didn't answer. Now I want to say you are a paid agent. You can't see a proof what sir is giving you right now.
Yeah, at least wait for us to recall now before saying something. You know, it hurts us also after working so hard, after doing so much for you guys. उसके बाद आप बोलोगे कुछ नहीं आया, इससे कुछ नहीं आया, this was different. To tell you the truth, like sir said, 200 questions were solvable. Okay, आप this happens, right? अचानक 12 क्वेश्चन आ जाते हैं which we know nothing about. Then you start panicking because you're like अरे 12 क्वेश्चन आ गए जो मुझे नहीं पता. But it doesn't mean कि all the 300 questions were not solvable. 200, like we can show you proof. कहाँ हम लोगों ने पढ़ाया था, कहाँ पारस ने पढ़ाया था, कहाँ मैंने पढ़ाया था, कहाँ हमारी फैकल्टी ने पढ़ाया था. Everything is there.
And they will show surgery OBG उनसे.
The test जो हमने दिए थे, the mock test I can show you, like
we'll give, don't worry, we'll give.
I can show you,
but we will give all,
we will give you the proof, we will give you PDFs.
Morphine, it was there with all the feature. ये भाई पढ़ाया है, ठीक है, फिर ये क्वेश्चन आया था मेनिया, मूड स्टेबलाइजर, लिथियम वाज
This was a PYQ also. Lithium, moods, anxiety.
मल्टी ड्रग, ये देखो सिर्फ कराया था ये अक्टूबर में, मल्टी ड्रग और एक्सट्रीम 2 ड्रग।
सर ये हम दोनों ने मिलके भी
ये
कराया था। PYQ भी है
I was
ये।
there in Sara and I said,
And even this thing we sat together, like NF1 we were showing the pearls, and that question came.
Look at this, and yeah,
That question
I'll
came.
show you this Leishmania, amphotericin B, drug of mucormycosis, again pharma, YouTube sessions I'm taking।
देखो
मेरी क्लास की तो बात ही छोड़ो, ये YouTube sessions।
देखो ये जो NLC pearls we were showing। Wait,
I'll just zoom it। See, this was what we discussed on the PYQ. You can see NF, autosomal dominant 1 and 2. I'll even show you. See, amphotericin B, drug of choice.
and we were sitting together and we were telling this. So if you have not watched the video, if you have not listened to us, अगर आप बस हंसने खेलने के लिए आते हो तो फिर
ये देख, autosomal dominant, heavy dominant, demonic, I discussed.
Yeah.
It is, yes, I made them remember the list, okay, neuro.
Even in NLC pearls we had given this. We were just sitting and we were talking about it.
So I will give all the proof, don't worry। See, male to male, father to son, मैंने कहा बाप बेटा दोनों ऑटो में आएंगे, बाप बेटा ऑटो में आए, autosomal dominant, I discussed that, male to male।
Mucormycosis also we taught it, the last ENT session जो मैंने लिया था वो उसमें भी था वो।
Yes।
Okay, it was there before also।
Cycling regular, even I discussed that in patho, all YouTube session, I'm not even counting my offline classes, they are double triple the content, but just free content of YouTube give 100 questions। So what else you are, ये question
और
dystrophic calcific atherosclerosis,
and there were people who were telling कि PYQ से what, there was this person who was telling nothing came from chanting, nothing came from PYQ, nothing was clinically
अभी chanting तो खोला भी
integrated।
नहीं है
यार
अभी आया भी नहीं। 100 questions अभी, और ये सिर्फ आशीष सर हैं, only Ashish sir। I said 50 from my 100 I've shown 100 Ashish sir, physiopatho, pharma, psychiatry, medicine। अभी इनकी तो मैंने दुकान खोली नहीं है, अभी PYQ और ये तो खोला नहीं है।
We can show you, we have
proof, will proof।
क्योंकि ऐसा है कि जब तक दिखाओ नहीं, you don't believe us, तो वो भी एक है। तो चलो, anyway sir, you continue, we will show them।
I will just wrap it up and then we'll call the faculties for them। Then this question, hyperthyroidism first trimester, was it there or not? Hyperthyroidism in first trimester, क्वेश्चन था नहीं था? It was there or not? First trimester, बताओ बच्चों, था नहीं था? Yes, it was there। Yeah, outlier question also I discussed in PSM। Okay, I'll show you। So it is treatment of this। Okay, what is the treatment? Again I discussed PYQ, drugs, you can see the class। So it was my class, I say carbimazole, longer acting, कार में मैं थी, मजे ले रही थी, देखो मैं निमोनिक बनाया था। And PTU inhibit deiodinase, even this was asked in the exam, deiodinase convert T4 to T3, D1 in the liver, kidney, I discussed that in physiology also। And drug of choice for first trimester pregnancy, this also was covered। This was again our topic I took। You can see my t-shirt, I was wearing other color t-shirt, they are not fake video, they are genuine one। If you want I can give you date also, link also, click on the link, and but don't say that we are lying about this, everything I am telling you live on the YouTube। Okay, ठीक है। Okay, so I think ma'am is ready। Okay, so we'll continue this question, Klinefelter question। Okay, this again I discuss live on YouTube, I said this। Okay, so I'll start with ma'am session because ma'am is ready, so we'll give chance for ma'am to take the session। I'll take a time out and I'll come back again। Let's welcome our Harmeet ma'am। Okay, she's coming। Okay, okay, till then I'll continue। So I discussed that Klinefelter with photo also, can you see it was taken on 21st September, at that time I was teaching paras etc। Okay, आ जाओ मैम, आओ मैम, आ जाओ। आपका कौन सा ये है नीचे का, देखो ये वाला ये पुराना वाला, और दूसरा देखो, हाँ ये सब चलेगा, कनेक्ट है ऑलरेडी, कनेक्ट है ऑलरेडी, आप आ जाओ, कनेक्ट है, पेंसिल आपकी है, कुछ नहीं करना मैम, आप बैठो बस। मैम आप हाँ ठीक है, you all come.
आप भी आ जाओ ना, ये ले लेगा, शिबू ले लेगा ना।
सेटअप हो जाए सर जी प्लीज।
हम लोग मोटे
So ma'am is here
Yeah.
live with us. Okay, so ma'am will be taking session.
Then Nidhi Bhagat sir for surgery and
Yeah.
orthopedics. So all
So we are honored to have ma'am का session था 2 दिन का, and that covered at least 15-20 question directly and indirectly. वो एंटी वाला क्वेश्चन तो ये आप ही ने कराया, बाकी तो कंफ्यूजन ला रहे थे हर जगह पे.
चलो, वेलकम यू ऑल.
Yeah ma'am, audible is.
So I hope you're all. Am I audible to all of you?
I just want to say I feel very happy with the female faculty.
Yes, you can say that. Yeah, thanks the NLC team for giving us the opportunity, and good evening to all of you. I'm just here to discuss some of the recall questions, and I felt very happy when I received so many messages from the students that 40 plus questions have come in your exam from the obs-gynae subject. Whatever we could collect, and students are keep on sending us the questions. जो हम collect कर पाए, let us just discuss and focus. And obs-gynae is always a very very important subject. Actually, जो pattern चल रहा है, that is going to be a NEXT pattern, and it is just a preparation. So medicine, surgery, obs-gynae, pediatrics, ENT, ophtha. These are the subjects which is going to remain. The rest of the subjects are going to be integrated. Okay? So whatever I could collect from the students that are sharing us the questions on the Telegram group and the NLC students. So we have just collected, and let us just go through. So many questions direct straight came from the rapid revision program that we have taken on the NLC platform, and things have become very very easy because many were the very very straight. So rapid revision we plan in such a way that it covers the whole of the syllabus, okay, and in a very very concise manner. So it really takes lot of time for the teachers to combine. Will you agree with me, Dr. Nitin?
Ma'am, there were so many questions which were integrated. We could not make out which subject they were asking actually.
Yes.
There were such questions. But ma'am, the problem is, the benefit is like when we shared the question, I also got the feedback that at least 30 questions were there directly from your rapid revision session, ma'am. So that was the benefit actually of the rapid revision session.
Yeah.
Without images, yeah. Not
So,
many images were there.
even if the students who have not been able to revise the subjects, they are also able to, solve many questions just by going through the rapid revision program. Okay. So, first question that came, कुछ एक हमने थोड़े से single liner के form में लिखे हैं because students are not able to tell us, the exact format of the question. So there was some history of secondary amenorrhea after a DNC was done and HSG image was given, and this HSG image purely shows Asherman syndrome. Okay, so always I tell you, whenever there is a, okay, there was a question on the hirsutis, I'll also add up. So whenever there is a DNC being done, after the DNC, for example, it is done for missed abortion or some reason or the other, whenever there is a vigorous curettage, okay, there will be formation of adhesions between anterior and posterior uterine wall, and that leads to the obliteration of the uterine cavity. Okay, so the synechiae are formed and that leads to obliteration of the uterine cavity. So first of all, there will be an oligomenorrhea, hypomenorrhea, secondary amenorrhea, and if the female is in the reproductive age group, it is okay. 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 So this was Asherman syndrome and it is an HSG image. What was the format of the question? So HSG image, if it was given, it is showing the Asherman syndrome. Okay. And what is the gold standard investigation? Always the gold standard investigation for Asherman syndrome is hysteroscopy. Students, I just want to add up one thing. Solving these questions and discussing with you, it will build up the confidence in you. Number two thing is, like, different students are sending us different questions. Okay, so exactly the students who have given the paper, they are the best guide to tell us what exactly had come. 4 students अलग अलग questions हमको लिख के दे रहे हैं, तो what we have done is हम चारों के accordingly we will be discussing. If this has come, this is the answer. If this has come, this is the answer. And many times you're not able to recollect what was the exact format of question. But this session is not just to limit your knowledge towards FMG. Think about your career beyond FMG. So next upcoming exam, those who have given fill the form is UPSC Combined Medical Services exam. So these sessions are going to be helpful for them. And once you enter into the internship, further exams you will be eligible and you will be writing. So these sessions are going to be useful for that also. Plus it will clear out your doubts when you will be working in the hospital as an intern and as a responsible doctor. Now the second question that came was identify the image, and this was a Leash-Wilkinson cannula.
Can I add something, ma'am?
Yes.
See, what I see, Dr. Aditya Sharma, Dr. Vishnuji. Now, the problem is that yes, the image may be different here. The image definitely may be different here because we cannot recall. We can recall the question, but we cannot recall exact image that has been asked there. Fine. So we basically go into the theme of the question. We go into the theme of the question, like what kind of question was there. At least you can make out for the next exam. NEET PG. You see, there's no difference between two of them. There's no difference in the the level of question between both of them. Fine. So that is the idea of the quick revision session, or that is the idea of recall session. Not that we'll be able to reproduce the exact thing. We don't have that kind of setting there anywhere.
So if you say that there was an image of the tubal block, I have already discussed this is an NLC rapid revision program which I have taken up. And if this is an image, this has already been discussed for you in the rapid revision session. This is an HSG image showing a tubal block. Okay. So whatever it is going to be, is it an Asherman syndrome or is it a tubal block, both were covered. So this is a Leash-Wilkinson cannula, and this cannula is put in the cervix and we inject a radio-opaque dye. Okay. And then an X-ray film is taken, that is dye entering into the uterus, film number 1. Dye entering into the fallopian tube, film number 2, and free spill of dye, film number 3. So this is a very, very important instrument to perform hysterosalpingography. Previously, it was a Rubin's cannula which was done for air insufflation. Now that is not been, nowadays it is not been used. So what we do is, this is the Leash-Wilkinson cannula and it is straight image based question, and we have even shared the soft copy of the images when we have taken up the regular sessions. And it is not that if I am taking up for the NLC students, whosoever asks me कि हमें PDF चाहिए, we are sharing it freely. We are sharing it freely. Idea is not just to help the NLC students. Idea is to help all the students who are giving the FMG exam. And also we are doing a career guidance also. What are the career options after MBBS? What are the exams you can give? So we are already releasing all that on the YouTube videos. You can later on watch. And soon we are going to cover up the UPSC session, and one I have already taken, another one 2021 exam of UPSC OBG questions I will take up, and simultaneously medicine surgery will be taken up by the specific faculties, because they are medicine, surgery, obs, gynae, PSM, pediatrics. These are the subjects which are being asked in the UPSC. ठीक है. So ये लीश विल्किंसन कैनुला है जो कि हमने already discuss किया था, and this is a question which has already been asked in the previous. So कहीं का भी स्टूडेंट है जिसने भी हमसे PDF मांगा है, we have already shared, और मेरे ग्रुप में तो टेलीग्राम में एटलीस्ट 50 टाइम्स शेयर करें. एवरी स्टूडेंट हु इज राइटिंग एंड वॉचिंग द यूट्यूब वीडियोज ऑफ NLC, उसमें टेलीग्राम ग्रुप का लिंक है. So they are joining and they are asking again and again, and we have shared that just to help out the students. Even one night before the exam, student has asked me and we have shared it to help the students. Okay, this is an HSG image. This is just to tell you कि this type of question has come in NEET PG. ठीक है. So what is the difference? ट्यूबल ब्लॉक भी पूछ रहे हैं and normal HSG images भी पूछ रहे हैं, plus instruments are also they are asking. So even if the name of the instrument was not there, this instrument is used during the HSG. So whatever format it is, if it is an image based, it is a leash Wilkinson cannula. If it is what it is used for, then it is HSG, hysterosalpingography. ठीक है. This is a normal HSG showing a free spill of dye. ठीक है. Normal HSG where you can see the uterine lining properly, you can see the fallopian tubes and free spill of the dye. Now next straight question which I have taken up the NLC rapid revision part 2, that was where I have discussed the obstetrics. पहले पार्ट में मैंने पहले दिन में गायनी डिस्कस किया था, जिसमें कि it was questions, it was image based questions, it was single liners, and at the end it was instruments. तो around 150 single liners मैंने दिए थे आपको, जिसमें से half of them were gynae and half were the OBG. जिन लोगों ने उसको अप्लाई किया है, definitely it is going to prove that your results will be rocking. Okay, so other subject questions मैं तो हमेशा सबसे पहले ऑब्स गायनी क्वेश्चंस ही देखती हूँ whatever. तो बाकी subject specialist Dr. Ashish will tell about the medicine and other subjects. Dr. Nitin will talk about the surgery questions. So I will only stick myself to the obs gynae. ठीक है. So 2 doctors' opinion is needed for doing MTP if the period of gestation is. So this we have already discussed कि 1971 MTP Act, MTP was applicable up to 20 weeks. So in 2020 MTP Amendment Act, the MTP upper limit has been increased to 24. ठीक है. So here I have already discussed in the MTP part, in the MTP specifically I have discussed and I have told you the guidelines also. So you can see this is the same PDF which has been shared in the groups, and this is the PDF I have given the soft copy to the students. So you can see the instruments also we have discussed, and you can see the leash Wilkinson cannula straight away. This was asked, and this is already written HSG. So you can always correlate this particular part. Okay, so I want to just show it few points that this is the same copy. You can see already written content, so which I have already discussed. Okay, so can you see, according to the MTP Act, it is upper limit is 24 weeks. Now the question was asked, opinion of 2 doctors or more than 1 doctors. So previously when it is 13 to 20 weeks, according to 1971 Act, there was opinion of 2 doctors needed. Now 13 to 20 weeks according to 2020 Act, नए एक्ट के अकॉर्डिंग 1 डॉक्टर ओपिनियन इज मोर देन एनफ टू परफॉर्म एमटीपी. जब एमटीपी 20 to 24 वीक्स के बीच में कर रहे हैं, देन ओपिनियन ऑफ 2 डॉक्टर्स इज मस्ट. प्लस आई हैव ऑल्सो डिस्कस्ड एमटीपी के 2 या 3 क्वेश्चंस आए हैं. इवन द ड्रग्स दैट आर बीन यूज्ड एग्जैक्टली अगेन इट इज द सेम. ओके, तो उसमें डिफरेंसेस क्या हैं? एक तो ओपिनियन ऑफ 1 or 2 डॉक्टर्स, एक अपर लिमिट हैज बीन इंक्रीज्ड, एक इफ द फीमेल इज अनमैरिड, if there is a failure of contraception like condom failure, previously she was not supposed to approach legally the MTP center, but now जो latest amendment act है उसके according she can legally ask the doctor, I was using a contraceptive method, I am unmarried and it is a failure of contraception like condom failure or whatever contraceptive she is using. So legally in the latest amendment act she can seek the medical help for MTP and doctor is not supposed to deny. So it again has come from our revision session at NLC. Okay, now there was another question and this has been discussed. It's an overlap question. Most common site for genital tuberculosis. This is verbally we tell and even the single liners which has been given. Okay, see the options sometimes we have to create. Okay, what were exactly the options, but आपको उसमें से gist समझ में आ जाना चाहिए कि what exactly. If they have asked opinion of 2 doctors or if the upper limit of MTP was asked, then these are the answers. ठीक है, so most common site for genital tuberculosis always is fallopian tube. 90% of the genital tuberculosis lies in the fallopian tube. And which part of the female genital tract is resistant is always vagina. ये बड़ा पुराना सा क्वेश्चन हो गया है, बहुत सिंपल क्वेश्चन है, बहुत ही स्ट्रेट क्वेश्चन है. तो हम एक बार कई बार वर्बली बोल देते हैं, हर चीज हम लिख नहीं सकते हैं on the sheet or line. So verbally I have discussed this most common site for genital tuberculosis, that is the fallopian tube. 90% of the genital tuberculosis lies in the fallopian tube and the presentation is tubal block. So it presents mostly with infertility. Okay. So next site is the uterus where it causes secondary amenorrhea, and vagina is resistant because vaginal epithelium is a multi-layered epithelium and usually the organisms do not invade the stratified squamous epithelium. Now 60-year-old female presented with postmenopausal bleeding. What is the likely cause? Okay, so you have to tell me the options. Actually, if it is senile endometritis or atrophic endometritis, then endometrial atrophy is the most likely cause. 70% cases of postmenopausal bleeding, it is senile endometritis. Now, if a female is presenting with postmenopausal bleeding, the first step in management is always a transvaginal scan to check for endometrial thickness. Okay, endometrial thickness. Only 10% cases of postmenopausal bleeding, the cause is endometrial cancer. In India, postmenopausal bleeding, we try to rule out cancer cervix because in our country, cancer cervix incidence is the most high. Okay? So overall, worldwide, the most common cause for postmenopausal bleeding is senile endometritis or endometrial atrophy. Okay? So हमें उसमें DNC नहीं कराना है. ठीक है, सबसे पहले ट्रांसवेजाइनल स्कैन, चेक फॉर एंडोमेट्रियल थिकनेस एंड endometrial thickness less than 4 mm, then you have to just keep the patient in follow. ठीक है, even if she is bleeding, so you have to just see and if she has second episode, then you can go for endometrial sampling or endometrial biopsy. ठीक है, endometrial sampling or biopsy. Another student has sent me a question on my telegram कि मैम एक क्वेश्चन आया था जिसमें पोस्ट मिनोपॉजल पेशेंट ब्लीड कर रही है और उसमें कॉजेस नहीं पूछे थे, इन्वेस्टिगेशन पूछा था. तो इन्वेस्टिगेशन में हमेशा ही या तो एंडोमेट्रियल सैम्पलिंग आएगा या डीएनसी आएगा. फ्रैक्शनल क्यूरेटाज इज अ गोल्ड स्टैंडर्ड. ठीक है, So there was a question, there is a septate uterus. Now students, one thing I want to say, whatever is the exam I am seeing in NEET PG and other exams, कैंसर सर्विक्स बहुत ज्यादा हो गया, ऑल्दो स्क्रीनिंग हाईली प्रिवेंटेबल सब कुछ आपको आता है. अब जो है ओवेरियन बी सर्विक्स ना पूछ के एंडोमेट्रियम पे बहुत ज्यादा फोकस है, चाहे वो फाइब्रॉइड हो चाहे वो एंडोमेट्रियल कैंसर हो, ठीक है, उससे रिलेटेड दे आर आस्किंग मोर क्वेश्चंस, हाइपरप्लेजिया, हाइपरट्रोफी. So friends, if you're giving me option endometrial hyperplasia or endometrial atrophy, then postmenopausal bleeding, I would like to mark endometrial hyperplasia. क्योंकि अगर hyperplasia है तभी जो है bleeding होगा, ठीक है. So trend has been changing for the questions. Now there was a question on the septate uterus that it is responsible for recurrent abortions. Next investigation क्या है, काफी ग्रुप्स में मैं देख रही हूँ मेट्रोप्लास्टी चल रहा है, ठीक है. सो मेट्रोप्लास्टी, वन क्वेश्चन वाज ऑन टेमोक्सिफेन. यस, वन स्टूडेंट इज राइटिंग टेमोक्सिफेन. टेमोक्सिफेन इज बेसिकली गिवन फॉर ब्रेस्ट कैंसर. वैसे तो डॉक्टर नितिन इज गोइंग टू एम्फसाइज ऑन मोर, ठीक है. एंड इट इज causing which cancer, the risk of which cancer is increased, so it is endometrial cancer. Okay, so septate uterus की always आप सबसे पहले HSG कराते हैं, but always the gold standard is hysteroscopy. So guys, if they have asked the treatment for that, so हमेशा uterine anomalies में, you know, like you operate if it is causing infertility or it is causing recurrent abortion. I will show you. ये भी again हमारे NLC के rapid revision program में है. मैंने जब रेगुलर बैच लिया था, ऑनलाइन बैच, तभी भी ये पार्ट पे काफी एम्फसाइज किया था. इवन HSG इमेजेस आल्सो आई हैड शोन. तो अगर सेप्टेट यूट्रस है, अब ये वाली इमेज है, ठीक है, इस इमेज में मैंने क्लियर किया था, अगर ये HSG पे दिखा है तो ये सेप्टेट यूट्रस है, ठीक है. इसमें जो एंगल होता है वो अराउंड 75 डिग्रीज होता है. अगर 110 है या 105 है तो वो बाइकॉर्नुएट यूट्रस होता है, ठीक है. सो इसमें हमारे पास गोल्ड स्टैंडर्ड इन्वेस्टिगेशन क्या आ जाती है. गोल्ड स्टैंडर्ड इन गायनी ऑलवेज मीन्स an investigation which is confirmatory and which is therapeutic. So this is a hysteroscopy image. Although why we are doing laparoscopy, ये laparoscopy image भी है, although सारी images हम लोग गूगल से ही डाउनलोड करते हैं. तो ये septate uterus है, ये laparoscopy पे दिख रहा है और ये hysteroscopy पे दिख रहा है. So guys, always I have told you 3D अल्ट्रासाउंड हम कराते हैं आजकल यूट्राइन एनोमलीज के लिए, बिकॉज MRI इज अ कॉस्टली इन्वेस्टिगेशन. सो इन्वेस्टिगेशन टू डायग्नोज मुलेरियन डक्ट एनोमलीज is 3D ultrasound or MRI, but always the gold standard investigation is hysteroscopy plus laparoscopy. Why hysto and lapro? Why we talk about hysto and lapro? Because septate uterus on HSG and bicornuate uterus looks like the same. दोनों सिमिलर जैसे लगते हैं, ठीक है. तो अगर septate uterus पूछा है तो हम हिस्ट्रोस्कोपी कर रहे हैं, और अगर bicornuate uterus पूछा है then we are doing laparoscopy. So surgery for bicornuate uterus is laparoscopy, and that is metroplasty. You are excising and you are reuniting. And hysteroscopy, you are doing the resection of the septum. Okay, so कहीं हम हिस्टोस्कोपी करते करते यूट्रस को परफोरेट ना कर दें, इसीलिए another surgeon or your assistant is doing a guarded laparoscopy. तो हम हिस्टोस्कोपी के साथ always we combine a laparoscopy. Number one, it will confirm your diagnosis, it will differentiate. It is exactly a septate uterus or it is a bicornuate uterus. If it is a septate uterus, then you're doing hysteroscopic guided resection. If it is a bicornuate uterus, then you're doing laparoscopy. ठीक है. Recurrent abortion है, septate uterus है, सर्जरी जो है वो है hysteroscopic guided resection. This images ही मैंने ऐड करी हैं just to explain, especially those students who are attending the session for the first time. और ये सारी images INI CET जब भी आप next में लिखोगे, एग्जाम्स में पीजी के लिए आप जरूर ट्राई कीजिए, तो ये इमेजेस इंपॉर्टेंट है। हाँ, अगर आप यूपीएससी एग्जाम बोलते हैं उसमें सारे क्लिनिकल क्वेश्चंस हैं, कोई इमेजेस नहीं आती है, ठीक है, बट नेगेटिव मार्किंग सब एग्जाम्स में। नाउ ड्रग अनसेफ इन प्रेगनेंसी, ठीक है, ऑलवेज आई हैव टोल्ड यू वारफरिन, ठीक है। सो जो भी क्वेश्चन आया था वारफरिन पे आया था, और आई हैव ऑलरेडी डिस्कस दिस कि लेस देन 12 weeks of pregnancy in a valvular heart disease, ठीक है, valvular heart disease or the patient on prosthetic valves is heparin, because heparin do not cross the placenta. 12 to 36 weeks it is warfarin. After 36 weeks to delivery it is again heparin, and after delivery again warfarin. Breastfeeding is not contraindicated if the patient is on warfarin.
Why not IVF? They're
What?
asking this question.
नहीं, IVF कभी भी रिकरेंट अबॉर्शन पेशेंट में ट्रीटमेंट नहीं है, हमेशा उसमें आप रिसेक्शन करेंगे। IVF स्पेसिफिकली याद रखिए, IVF इज अ ट्रीटमेंट फॉर बायलैटरल ट्यूबल ब्लॉक, IVF is a treatment for severe endometriosis, IVF is a treatment for like azoospermia, ठीक है, मेल फैक्टर ऑफ इनफर्टिलिटी। सो उसके स्पेसिफिक इंडिकेशंस हैं, कभी भी रिकरेंट अबॉर्शंस में IVF नहीं आता, कोई बात नहीं।
नहीं, ये बच्चे मेरी बात कर रहे हैं, वो 8 बजने वाले हैं ना, तो मुझे याद कर रहे हैं, 8 बजे याद करते हैं।
अच्छा, 8 बजे याद करते हैं,
8 बजे मुझे याद करते हैं, मैं उनको याद करता हूँ।
अच्छा, ठीक है। So identify the case. So students, unsafe drug in first trimester is warfarin, जो भी आपकी options थी।
She is using warfarin.
हाँ, ड्रग टू बी रिप्लेस्ड, तो वारफरिन अगर यूज कर रही है तो ड्रग टू बी रिप्लेस्ड क्या आ जाएगा, लो मॉलिक्यूलर वेट हेपरिन। बट जिस भी फॉर्मेट में क्वेश्चन है मैं उसके अकॉर्डिंग आपको बता रही हूँ, जो भी आपका क्वेश्चन था कि अगर शी इज यूजिंग वारफरिन सो इट शुड बी रिप्लेस्ड बाय हेपरिन, बिकॉज
placenta previa also, no? अच्छा, okay, that's great, ma'am.
ओके। सो देयर वाज एन इमेज, एंड ये ऑलरेडी अपने सेशंस में हम लोगों ने दिखाई थी ऑलरेडी, जब आई हैव टेकन अ टॉपिक ऑफ APH। सो दिस इमेज वाज गिवन, एंड यू कैन सी नॉर्मली द प्लेसेंटा इज अपर सेगमेंट, एंड इफ देयर इज अ रेट्रोप्लेसेंटल क्लॉट, देयर इज हिस्ट्री ऑफ फॉल, then it is placental abruption. So if there is a placenta like this on the lower uterine segment, then it is placenta previa.
If you might like to
नहीं, सारी images नहीं थी, एक image थी।
you might like to shift your seat a bit, ma'am, so that they can see. इस पे थोड़ा डिले के साथ, that's it, ma'am.
ठीक है। सो प्लेसेंटा प्रीविया, सो ये इमेज एक ही थी, मैंने इसको क्रॉप नहीं किया जस्ट टू शो इट एब्रप्शियो। तो इमेज सिर्फ इतनी आई थी, तो उसमें इट वाज प्लेसेंटा प्रीविया। आई थिंक सिंपलर, आई थिंक एवरीबडी शुड हैव मार्क्ड इट वेरी वेरी करेक्टली। सो ये टोटल प्लेसेंटा प्रीविया ही है, ठीक है। देन चॉइस ऑफ कॉन्ट्रासेप्शन, देयर वाज अ क्वेश्चन, ठीक है, एंड स्पेसिंग बिटवीन द टू प्रेगनेंसीज, ये लैंग्वेज नहीं थी, लैंग्वेज थोड़ा डिफरेंट था, बट स्टूडेंट हैज गिवन मी, तो मैंने उसको एग्जैक्टली सेम फॉर्मेट में डाल दिया है। चॉइस ऑफ कॉन्ट्रासेप्शन वर्ड नहीं शायद लिखा था उसमें, स्पेसिंग कॉन्ट्रासेप्टिव बिटवीन द टू प्रेगनेंसीज, तो उसमें हमेशा कॉपर टी आएगा। स्पेसिंग के लिए हमेशा ही हम कॉपर टी यूज करते हैं, ठीक है, क्योंकि अगर OCPs खा रही है, इफ शी फॉरगेट्स टू टेक 1 टैबलेट ऑफ OCP शी माइट कंसीव, ठीक है। सो इमेज नहीं था, इमेजेस आई हैव पुट जस्ट टू एक्सप्लेन, इमेज वाज नॉट गिवन, इवन आई नो। इमेजेस मैंने सिर्फ इसलिए ऐड करा है ताकि it gives you a clarity, and this is an image of copper T 380A. So there was just a question, not the image. Image has been added just to yes, she is breastfeeding. What is the choice of contraception? It is always IUCD, ठीक है, for spacing. Now there was a image, ये काफी जगह कंफ्यूज है। जेनिटल प्रोलैप्स में क्वेश्चन था कि इमेज था, जो भी था हम लोग इसमें दोनों तीनों चीजें डिस्कस करेंगे। एक स्टूडेंट ने मुझे सर्वाइकल डिसेंट, सिस्टोसील, रेक्टोसील की इमेज दी है, तो अगर एल्डरली पेशेंट है, अनफिट फॉर सर्जरी है, तो उसमें लीफ फोर्स रिपेयर आएगा कि हम उसमें जेनिटल प्रोलैप्स को अंदर डालते हैं एंड वी स्टिच बोथ द एंटीरियर पोस्टीरियर वेजाइनल वॉल, इफ दैट वाज द क्वेश्चन। If there is a question, 60-year-old female and there is a cervical descent or prolapse, ठीक है, cervix is visible outside, cystocele is plus, rectocele is plus, then my friends answer is not Leafold's repair. In that case the answer will be vaginal hysterectomy with pelvic floor repair. So you are a better judge of the questions. Elderly female दिया है, unfit for surgery है, तो हम लीफोर्ड्स रिपेयर करते हैं जेनिटल प्रोलैप्स, जिसमें 70-80 ईयर ओल्ड फीमेल देते हैं. और अगर कोई 60 ईयर ओल्ड फीमेल है देन इतनी एल्डरली भी नहीं है कि हम उसमें ऑपरेट ना कर सके, तो इसमें हम ऑपरेट कर सकते हैं. सर्वाइकल डिसेंट है, सिस्टोसील है, दैट इज ब्लैडर प्रोलैप्सिंग इन द वेजाइना, रेक्टोसील है, रेक्टम प्रोलैप्सिंग इन द वेजाइना. तो उन केसेस में स्टूडेंट्स ट्रीटमेंट आता है वेजाइनल हिस्टेरेक्टमी विद पेल्विक फ्लोर रिपेयर. ठीक है. While doing a pelvic floor repair, most commonly damaged organ is urinary bladder. तभी हम हमेशा जो है हम जो है ब्लैडर साउंड डाल के लिमिट चेक करते रहते हैं टू बी ऑन सेफर साइड कि कहीं ना कहीं हमने ब्लैडर इंजरी तो नहीं कर दी. सो 60 ईयर ओल्ड फीमेल नो इमेज. प्लेसेंटा एक्रीटा के क्वेश्चंस इस तरह से नहीं आते. सर्वाइकोपेक्सी, कॉल्पोपेरिनियोरेफी, ये सारा जो है यंग फीमेल्स में है. ठीक है. That was young female. Fine. If it is a genital prolapse, young female, then it is cervicopaxy, that is abdominal sling operations. If it is elderly female, unfit for surgery, then it is Leafold's repair. If it is a menopausal age group, 60 year or 50 year, but family complete, cervical descent, cystocele, rectocele, then it is vaginal hysterectomy. Okay, with pelvic floor repair. So anticoagulation, I have already discussed this particular part. Then drug of choice for hyperthyroidism in pregnancy. ठीक है. They have not marked the trimester. ठीक है. So it is propylthiouracil if it is in the first trimester of pregnancy. अगर हम फर्स्ट ट्राइमेस्टर ऑफ प्रेगनेंसी की बात करें तो सेफ एंटी थायराइड ड्रग इज प्रोपाइलथायोरेसिल बिकॉज इट डू नॉट क्रॉस प्लेसेंटा, और यू कैन से इट इज नॉट टेरेटोजेनिक. इट इज नॉट टेरेटोजेनिक, डज नॉट कॉज एनी टेरेटोजेनिक इफेक्ट. ठीक है. ये क्वेश्चन हम ऑलरेडी डिस्कस कर चुके हैं. इवन इन द सिंगल लाइनर्स फॉर्म आई हैव गिवन.
ये तो मैम दिस क्वेश्चन आई डिस्कस इन सर्जरी आल्सो व्हाइल वी डिस्कसिंग द मैनेजमेंट ऑफ थायराइड स्टोन.
हम ऑलरेडी इस सीक्वेंस में चला तो रहे हैं.
इसमें ठीक चल रहा है, उसमें थोड़ा सा डिले के साथ आता है शायद. यहाँ उल्टा हो रहा है, इसमें डिले में आ रहा है, वहाँ पे क्विकली आ रहा है. there's a lag of around 30-40 seconds.
Students are writing the chair is hiding actually. Either you just adjust. Okay. Some adjustment has to be done.
Can you just put it down, ma'am? थोड़ा chair नीचे कर.
नहीं, उसकी वजह से नहीं.
शिबू मैम का और मेरा वाला पार्ट थोड़ा स्क्वीज कर दो. अगर सपोज इमेज पार्ट अगर थोड़ा स्क्वीज कर देते हैं तो.
देखो, अगर फर्स्ट ट्राइमेस्टर है तो प्रोपाइलथायोरेसिल है. नाउ इफ इट इज अ सेकंड एंड थर्ड trimester, then already I have discussed it is carbimazole. ठीक है. Second and third trimester, this we have already discussed in FMG exam 2018. They have asked a question on carbimazole. ठीक है. देखो स्टूडेंट्स, you are the ones who can be the better judge because you have given the exam. अगर ड्रग ऑफ चॉइस फॉर हाइपरथायराइडिज्म इन प्रेगनेंसी है जनरल क्वेश्चन, तो प्रोपाइलथायोरेसिल है बिकॉज इट इज नॉट कॉजिंग एनी टेरेटोजेनिक इफेक्ट. बट व्हेन इट कम्स टू ट्रीट द सेकंड एंड थर्ड ट्राइमेस्टर, देन इट इज कार्बिमेजोल. ठीक है. इट इज ऑलरेडी कंफर्म्ड आंसर फ्रॉम फार्मा, सो प्लीज डोंट चैलेंज दिस आंसर. नाउ ड्रग टू बी गिवन फॉर एमटीपी बाय मेडिकल मेथड, मैंने स्ट्रेट ये सब क्वेश्चंस ऑलरेडी डिस्कस करे हैं. ठीक है. So already abortifacient drugs we have already discussed. ठीक है. In the session, वारफेरिन मैंने ऑलरेडी एक क्वेश्चन भी डाला था, वारफेरिन पे है प्रेगनेंसी टेस्ट पॉजिटिव है, व्हाट इज टू बी डन, यू आर रिप्लेसिंग इट विद हेपरिन। अगर ये क्वेश्चन आया तो ऑलरेडी मेरे रैपिड रिवीजन में था ये क्वेश्चन, ठीक है। देन देयर वाज अ क्वेश्चन ऑन I suppose MTP drugs that has also been discussed. Drug for MTP. Actually इसमें शो करना थोड़ा मुश्किल रहता है,
जम्बल्ड अप है।
हाँ जम्बल्ड अप होता है, तो I think वो बाद में भी कर
Shibu, are you there?
Yeah, we can just discuss it. So mifepristone followed by misoprostol is the right answer, and I'm sure 100% of all of you must have written it very, very correctly. ठीक है, mifepristone followed by misoprostol is the answer. This is a standard and it is to be given within 7 weeks of pregnancy. Dose of mifepristone is 200 milligram oral and misoprostol is 800 microgram. Vaginal nowadays is preferred, but if you want to give only oral, then it is 200 and 400. So I think a straight question and I am sure everybody must have written it very, very correctly. Now there was a question on secondary postpartum hemorrhage develops after. Always we have discussed secondary PPH develops after 24 hours. Within 24 hours, it is primary postpartum hemorrhage. So secondary postpartum hemorrhage हम कब तक लेते हैं? After 24 hours till 3rd month of delivery तक हम लेते हैं secondary PPH, and the most common cause for secondary PPH is retained bits of placenta. Retained bits of placenta. ठीक है, that is succenturiata lobe. Succenturiata lobe. ठीक है, टेक्स्ट बुक के अकॉर्डिंग 24 आवर्स टू 3 months है, इट इज नॉट 6 weeks. So secondary postpartum hemorrhage developing after 24 hours and most common cause is retained bits of placenta where there is a succenturiata lobe. Then this again image based questions, हम already मैंने एक सॉफ्ट कॉपी गाइनी इमेजेस एंड ऑप्स इमेजेस ऑलरेडी शेयर करी है, टेलीग्राम ग्रुप में भी शेयर करी थी और पर्सनली भी एनएलसी ग्रुप में भी शेयर है ये इमेजेस, और उसमें से अगेन एक स्ट्रेट क्वेश्चन है टुडे के ऊपर, व्हाट इज द टाइप ऑफ स्पर्मिसाइडल एजेंट, इट इज नेनॉक्सिनॉल 9. सो टुडे इज अ वेजाइनल स्पॉन्ज एंड एक्चुअली इट इज अ बैरियर कॉन्ट्रासेप्टिव. ठीक है, it is barrier contraceptive which is releasing a spermicidal agent nenoxinol 9. So barrier को always effective बनाने के लिए हमेशा ही advisable to use a spermicidal agent like in the form of cream. So इसी तरह से diaphragm जो है उसके साथ हमेशा spermicidal use करना है. Today के अंदर already एक spermicidal agent है. So if there is a slippage of the barrier contraceptive, then spermicidal agent can take care of the release sperms. They are surface active agents and they can neutralize. ठीक है. Then there was a question something on the folic acid deficiency. कुछ students ने मुझे anencefali लिख के दिया है, but actually मेरे हिसाब से जो होना चाहिए folic acid deficiency usually causes neural tube defects. ठीक है, anencefali में कहीं पे भी folic acid deficiency कहीं पे भी marked नहीं है. ठीक है, anencefali is the earliest congenital anomaly that can be picked up on ultrasound provided if Down syndrome is not given. क्योंकि Down syndrome में न्यूकल ट्रांसल्यूसेंसी वगैरह हम लोग पिक कर सकते हैं. ठीक है, बट कंजेनिटल एनोमली ग्रॉस एनोमलीज में हमेशा anencefali आता है. फॉलिक एसिड डेफिशिएंसी काफी पुराना, स्ट्रेट अवे 10 साल 15 साल पुराना क्वेश्चन है. ठीक है, तो अगर ये क्वेश्चन आया तो इसमें न्यूरल ट्यूब डिफेक्ट्स आएगा. दूसरा एक सेक्स डिटर्मिनेशन लीगल पूछा गया था. ठीक है, देयर वाज सम ऑप्शंस. ठीक है, कि हम अगर सेक्स डिटर्मिनेशन कर रहे हैं तो किस चीज के लिए वो लीगल मानते हैं. सो इट इज सेक्स लिंक्ड डिसऑर्डर्स जैसे कहते हैं. मैं एग्जांपल देना चाहूंगी. इसमें एग्जांपल आता है कंजेनिटल एड्रेनल हाइपरप्लेजिया. ठीक है, एक फीमेल है जिसमें ऑलरेडी एक बेबी बॉर्न हो चुका है जिसमें कि एम्बिगुअस जेनिटेलिया है, विरिलाइजेशन ऑफ द फीमेल चाइल्ड है. तो मैं बता दूं कंजेनिटल एड्रेनल हाइपरप्लेजिया का कैरियोटाइप ही 46XX है. इसका मतलब मेल फिटस में होगा ही नहीं ना ये. तो ये एक्स लिंक डिसऑर्डर्स हो गए। तो इस केसेस में सेक्स डिटर्मिनेशन के लिए सेफेस्ट इन्वेस्टिगेशन है एमनियोसेंटेसिस। हमने एमनियोसेंटेसिस लिया और इसका बेस्ट टाइम है एमनियोसेंटेसिस का 16 वीक्स, ठीक है। हमने अल्ट्रासाउंड किया, अल्ट्रासाउंड गाइडेड एमनियोटिक फ्लूइड लिया, एमनियोटिक सेल्स को हमने कल्चर किया और उसमें हमने कैरियोटाइपिंग किया। आजकल फिश टेक्निक भी है, फ्लोरेसेंट इन सीटू हाइब्रिडाइजेशन टेक्निक, जिससे हम कुछ पर्टिकुलर पार्ट हम कट करके देख सकते हैं अगर कहीं पे कोई क्रोमोसोमल एनॉमली है, जैसे ट्राइसोमी 21 आप सस्पेक्ट कर रहे हो, ट्राइसोमी 18 सस्पेक्ट कर रहे हो, ओके, इन दैट केस। तो द क्वेश्चन वट एवर फॉर्मेट इट वॉज देयर, so the sex determination is basically done for sex linked disorders. Example I have given you, I have just quoted congenital adrenal hyperplasia. Similarly, there can be other problems which can be in the male fetus or in the female fetus. So confirmatory investigations for this is chorionic villus sampling, amniocentesis, which has been done, and you can do the chromosomal analysis. There was a question on the Chadwick sign. Now what was the question? Students have just written Chadwick sign. अब Chadwick sign में period of gestation पूछा है तो 8th week है। अगर signs of early pregnancy पूछा है तो फिर first trimester का sign है ये। This is on per speculum examination and it is a sign of first trimester of pregnancy. So you can see अगर image based पूछा है तो image ऐसे दिखती है, ठीक है। So whatever it may be, you are a better judge because you have given the paper. You cannot show me कि image based आया था, you can just write it to me. Picture हम जो है हम नेट से ही लेते हैं, तो मैंने इसको 4 फॉर्मेट में लिख दिया है स्लाइड में कि Chadwick question was asked, is it a sign of early pregnancy? Then it is yes. If they asked period of gestation, then it is 8 weeks. If they have given image, then this is the image on per speculum examination, bluish coloration of the vestibule and antevaginal wall. If they have asked what is it, then it is dusky hue coloration. So you are a better judge. जो भी चीज है Chadwick sign, इन चारों में से कोई एक क्वेश्चन तो आया ही होगा ना, ठीक है। नहीं, अब या तो हमें आप क्वेश्चन बताएं तो हम बता सकते हैं, तो अब 4 तरीके में से कोई एक तरीका तो बनता ही है ना, तो मैंने चारों के चारों डाल दिए इसके अंदर, ठीक है। देन वैक्सीन गिवन एट बर्थ, आई थिंक वैसे तो ये PSM का क्वेश्चन है, PSM का क्वेश्चन है क्योंकि ज्यादातर, बट ऑल्दो गायनेकोलॉजिस्ट भी वैक्सीनेशन कर रहे हैं, पीडियाट्रिशियन भी कर रहे हैं, PSM वाले भी कर रहे हैं, मेडिसिन वाले जिन्होंने रखा है सभी लोग कर रहे हैं। तो आई थिंक बेसिक सा क्वेश्चन है, सबको ही पता है, BCG, OPV एंड हेपेटाइटिस बी। और ये नाइसिन डेफिशिएंसी भी पेलेग्रा सबको पता है, ये नेकलेस पैटर्न, और वैसे देखा जाए तो PSM में, माइक्रो में, स्किन में, डर्मा में, मेडिसिन में, सब बायोकेम में, सब में कवर होता है। तो ओवरलैपिंग क्वेश्चन है और इसके बारे में डिटेल्स तो जो है ना बताने का कोई पॉइंट नहीं। आई थिंक ये सब हो ही चुका है, हम लोग ठीक है डिस्कस कर ही चुके हैं। अब इमेज बेस्ड क्वेश्चन है जिसमें स्टूडेंट कंफ्यूज्ड है कि भाई उन्होंने जेनिटल प्रोलैप्स पूछा है, जेनिटल प्रोलैप्स में अब ये है यूट्राइन प्रोलैप्स। देखो इसमें सिर्फ यूट्रस प्रोलैप्स कर रहा है तो यूट्राइन प्रोलैप्स का डायग्राम है। अगर ब्लैडर प्रोलैप्स कर रहा है इन द वजाइना तो सिस्टोसील है, पीछे से रेक्टम प्रोलैप्स कर रहा है तो रेक्टोसील है, ओमेंटम प्रोलैप्स कर रहा है तो एंटेरोसील। या तो ये क्वेश्चन है या फिर इमेज है जिसमें फिस्टुला है। तो ये फिस्टुला है कि यूट्रस का यूरिनरी ब्लैडर के साथ एक कम्युनिकेशन फिस्टुलस ट्रैक्ट डेवलप हो गया है, तो उसके अकॉर्डिंग आंसर वेसाइकोवेजाइनल फिस्टुला है। सो मोस्ट कॉमन कॉज वर VVF इन इंडिया, इंडिया में हमेशा ही आएगा ऑब्स्ट्रक्टेड लेबर, that is delivery conducted by untrained personnel. Obstructed labor, if you talk about the western countries, then it is Vardheim's hysterectomy. ठीक है, so you are a better judge. Is it a fistula that was asked? Then it is a vesicovaginal fistula commonly. Ureterovaginal FMG लेवल पे इतना commonly नहीं पूछते। अब ये टाइप्स ऑफ जेनिटल प्रोलैप्स मैंने ऑलरेडी इमेज डाउनलोड करके दे दिया है कि जिसमें कौन सा आया है आप देख सकते हैं। अब एक फेशियल पिगमेंटेशन का था क्वेश्चन था या इमेज थी, जो भी था, इमेज मैंने डाल दिया ताकि आप इजीली देख सके। सो इसके हिसाब से कोलाज्मा है, दैट इज द पिगमेंटेशन ऑन द फेस, दिस इज अकरिंग इन अ प्रेग्नेंट फीमेल। देयर वाज अ लॉन्ग क्वेश्चन, एक लॉन्ग MCQ था, ठीक है, और उसका जो मुझे जजमेंट समझ में आया, क्योंकि उसमें ना जो भी स्टूडेंट ने टाइप करा है वो बिल्कुल क्लियरली उसमें लिखा नहीं है, तो उसमें अगर मिल्क इजेक्शन है तो उसमें ऑलवेज ऑक्सीटोसिन है कि लेडी हैज डिलीवर्ड एंड डिलीवरी के बाद ब्रेस्ट फीडिंग इनिशिएटेड रिफ्लेक्स क्या है, देन मिल्क इजेक्शन रिफ्लेक्स इज ऑलवेज ऑक्सीटोसिन। इन सारे हार्मोन्स का कोई रोल नहीं है। ईस्ट्रोजन लेवल फॉल करते हैं प्रोलैक्टिन, बट प्रोलैक्टिन इज फॉर मिल्क सिंथेसिस, ईस्ट्रोजन प्रोजेस्टेरोन इज फॉर breast or mammary gland preparation. So the answer was oxytocin. Now, according to the WHO, what is maternal death? Although this question overlaps between gynae and PSM, लेकिन ज्यादातर ये PSM में ज्यादा डिस्कस होता है compared to gynae. So maternal deaths में हमेशा ही maternal death within 6 weeks of delivery, या तो during pregnancy में death हो रही है, ड्यूरिंग चाइल्ड लेबर में हो रही है, पोस्टपार्टम में हो रही है, विद इन 6 वीक्स ऑफ डिलीवरी। अगर हम नेट से देखते हैं तो 42 डेज ऑफ डिलीवरी ये सारे कॉजेज जो है मैटरनल डेथ में होते हैं, और इसका डिनोमिनेटर क्या आता है, लैक लाइफ बर्थ्स के हिसाब से लेते हैं, ठीक है। सो डेफिनेशन यही है कि एनुअल नंबर ऑफ फीमेल डेथ्स फ्रॉम एनी कॉज रिलेटेड और एग्रावेटेड इन प्रेगनेंसी, ठीक है, एक्सक्लूडिंग एक्सीडेंटल एंड ऑल, ड्यूरिंग प्रेगनेंसी यानी कि प्रेगनेंसी रिलेटेड केसेस के अकॉर्डिंग है, तो विद इन 42 डेज ऑफ टर्मिनेशन ऑफ प्रेगनेंसी इररेस्पेक्टिव ऑफ द ड्यूरेशन और द साइट। नाउ बिफोर लैप्रोस्कोपिक सर्जरी, ये क्वेश्चन आपका सर्जरी में आई थिंक डॉक्टर नितिन विल बी एबल टू टेल यू बेटर इन दिस, ठीक है, और इट इज कवर्ड इन एनेस्थीसिया, क्योंकि गायनी से ज्यादा लैप्रोस्कोपिक सर्जरी वाले ज्यादा करते हैं, गायनी वाले भी करते हैं, बट हमारी लिमिटेड है। बट इनकी सर्जरी वाले तो हर एक फील्ड में लैप्रोस्कोपी लेके आ रहे हैं, ठीक है।
10 hours before OT, patient has to be kept NPO, ma'am.
हाँ, बट इसमें ना ये कह रहे हैं कि इसमें
On table hair removal should not be done by razor. Hair should be clipped actually. This was I
and
mean,
even creams,
हाँ ma'am.
creams or razor.
Anything could be there, but you know when we use the razor that causes
So this
micro
question,
abrasions, ma'am.
ठीक है, दिस क्वेश्चन एनपीओ का यही है। वैसे हम लोग एज अ सर्जन्स तो हम यही कहते थे कि ओवरनाइट फास्टिंग आफ्टर 10 PM करके। सो दिस क्वेश्चन विल बी टेकन एंड डिस्कस बाय डॉक्टर नितिन, ठीक है। सो वी वेलकम यू मोर एंड मोर क्वेश्चंस, प्लीज डू शेयर विद अस, ठीक है। रेस्ट ओवर टू डॉक्टर आशीष एंड डॉक्टर Nitin. So you can keep on sending us your questions and we will keep
Anything
on.
you can ask from ma'am. Any other suggestion you can ask. ठीक है.
Clip. Always clip.
Clipping
No
is
razor
So
use.
the answer is clips if it is given. ठीक है. So sir will discuss this question.
मैं अपना आईडी लिख दूँ.
अरे इसको तो लिखना बड़ा मुश्किल हो जाएगा.
यहाँ लिख दूँ ना. चलो कोई नहीं. We'll send, okay. We'll send the link in.
Dr. Shibu, please send the Telegram link in the chat. He knows and he will send the link.
Yeah, clipping is correct.
Right. Thank you.
ठीक है. So over to Dr. Ashish and Dr. Nitin.
Yeah, sure. Thank you.
Dr. Shibu, please help Dr. Nitin arrange. Okay. जी सर, मैं आता हूँ अभी.
Right, sir.
मैं आपको ज्वाइन करता हूँ.
Sir.
नहीं मैम.
Apology.
1 second, sir. I'm just.
Dr. GS, you know, I read, am I live?
Voice is in you.
Your voice is live. Okay.
Voice is on.
Dr. GS, you know, on the table, it has to be done on the table. We'll discuss this question. Don't worry. Oh, correct. We are just connecting. They're just connecting my laptop. That's why the voice is. That's why the screen is gone. It will be back in a minute. Yeah, the video will be back in a minute. Yeah, sure. ना फोल्डर ना खोलना. We won't open the folder, don't worry. Yes, so Shibu, I need to adjust. Shibu, can you just shift me slightly towards the right on the screen? You know the way I'm gaining weight, थोड़ी देर में मैं पूरी screen cover करने लग जाऊंगा. I'm so happy to talk to you guys, always, as always. So they have given me the driving seat at 8 o'clock. हमारे यहाँ 8 बजे के बाद घर की चाबी नहीं देते किसी को, इन्होंने मुझे ड्राइविंग सीट पे बिठा दिया. पार्टी आई हैड आप लोग आए नहीं, आपके हिस्से की भी मुझे पीनी पड़ी. शक्ल नहीं दिख रही, मेरी आंखें दिख रही हैं. वो 4 तारीख के बाद का असर है अभी तक. चैट रिफ्रेश, दे से वी नीड टू रिफ्रेश द चैट. भैया को बोलो चैट रिफ्रेश करें, देयर इज अ लैग. वी नीड टू रिफ्रेश द चैट, पर ये तो रिफ्रेश होगी नहीं. इसको बंद करके दोबारा खोलें. It will not be lag. Let it be. Right, guys. So let me just, first of all, please, it's not a self promotion at all, but what I've done is that, like, I'll be opening the PPTs in front of you. And first of all, I won't be taking too much of your time. We'll be able to finish it very quickly because, we have not got many of the questions. I did try all my sources. I did mention it in the groups also that please share the surgery question. Whatever little surgery question we could gather, they're already there. We are discussing it right now. Let me open all the PPTs in front of you and let me tell you what kind of question were there in the examination. Fine. Ortho won't take more than 10 minutes. Surgery won't take more than 10-15 minutes. Fine. So we'll finish it quickly. I understand that, but this time you will be tired. Now, if you can see this question on your screens. Now, my idea is to tell you, you all have the PPTs with you. My PPTs. सारी की सारी PPTs, चाहे वो टेस्ट एंड डिस्कशन बैच हो, चाहे रैपिड रिविजन बैच हो, रेगुलर बैच हो, ऑनलाइन बैच हो. I've shared all these PPTs. Fine? Now, question के बीच में memes नहीं है. General surgery, there were so many questions there. Thank you. I'm so glad. You see, this question was there. And if you see the PPT, right now after this class, after this session, if you see the PPT, all the PPTs are as it is. I did not change even a single PPT after the exam result. After the questions were out, I did not change the PPTs at all. And if you can see, this question was discussed in the online class. This question was discussed in the offline class rapid revision session. Straight. Absolutely straight, this question was there that a middle-aged woman slipped on a frozen path and landed on her right shoulder. So that means there is a history of trauma. She developed a persistent severe ache. X-ray showed no fracture. So that means I believe that X-rays, they were normal. Yeah, they were. She was given non-steroidal anti-inflammatory drugs. Her pain subsided, but she does have a markedly reduced range of movement, particularly with external rotation. There are no associated neurological or vascular deficits. Likely diagnosis, as I told in the class, likely diagnosis would be frozen shoulder. Why? It is not a stress fracture because in all the stress fracture, we will be looking for point tenderness, which is not there in this question. Fine. Everyone who has attended the rapid revision batch, everyone who has attended the regular batch, you saw this question. You saw us discussing this question. Fine. Clinically obscure posterior shoulder dislocation. Clinically obscure means it is hidden. You cannot make out clinically, but on X-ray, this would be visible. Remember, on X-ray, there would have been light bulb sign, which is not there in the option because they are saying that the X-rays are normal. Fine. Bankart tear. Bankart tear 2 would be visible on the X-ray. Fine. So answer in this case is frozen shoulder. Frozen shoulder. Rotator cuff tear. See, rotator cuff tear was there in the option, Dr. Vishnu. Okay. What else? What else was there in the option? See, this was there. Posterior dislocation was there in the option. Stress fracture was there in the option. See, even in that case, when the X-rays are normal, frozen shoulder was there in the option. Frozen shoulder. So then answer is frozen shoulder only. This question is based on frozen. See, examiner is smart. Examiner is smart. He'll change some of the options. One or two of the options he is definitely going to change. So I believe here in all probabilities the answer is frozen shoulder. Answer would be frozen shoulder. Yes, that is the answer. Fine. So this was there in the test series. This was there in the test series. Fine. I'll switch this PPT off so that we can shift to the next PPT. Yes. See here. So this question now, there was a question on the fracture of clavicle. Fracture of clavicle. Now this, these ink annotations, they are from your class. I did not remove these ink annotations. Fine. Remember, I told you that the outer 1/3 of the clavicle is flat and inner 2/3 of the clavicle is round. Inner 2/3 of the clavicle is round. Right? That is why the fractures are very common at the junction of the middle 2/3 and outer 1/3. The fractures are very common here. If you go with the textbooks, what do they mention? That most of the fractures, they are commonly seen in the middle part, He did try to trick, and that's very sad actually. That's very sad. Coccydynia, we'll discuss that. Fine. There's a pain. The most common site of the fracture is middle. But you see, in the class I did tell you this. That the fracture most commonly occurs at the junction of outer 1/3, which is flat, and inner 2/3, which is round or cylindrical. We also call this tubular. He's smart. Fine. But this is like not done. Right? So let me see. There was another question from the upper limb. I believe they asked about the fracture scaphoid. They did ask about the fracture scaphoid. Now, remember, there was probably a question on the cast. Fine. Now, you see this. This was the mechanism which they asked. Foosh, fall on the outstretched hands. If you remember in the class, we clearly discussed that if the foosh, fall on the outstretched hands, occurs in children, what will be the fracture? Supracondylar fracture of humerus. If it occurs in young adults, that will be the fracture of scaphoid. Fine. If it occurs in the elderly, this would lead to Colles fracture. Fine. But you see here, the Colles fracture has to be treated with a handshake cast. You see, the hand has to go like this. Fine, hand has to go like this. There would be ulnar deviation of the fingers. There would be ulnar deviation of the fingers. Fine, ulnar deviation of the fingers. Fine, you see here, like this. But this was not the answer. This was not the answer. Let's see what was the answer there. We did discuss all the type of, the fractures there. All the type of fractures. Fine. And remember, we did discuss the fracture of the scaphoid. Fracture of the scaphoid. Yes, exactly. Fracture of the scaphoid we discussed. See. Remember, we read in the clinical feature, there will be fullness in the anatomical snuff box. Fullness in the anatomical snuff box. Fine. See, we did discuss it with the help of this story there, the Dr. Kabir Singh example, right? And remember, Dr. Kabir Singh is fond of drinking, like me. I mean, like many of us, right? So you see here, his prescription was glass holding cast. Glass holding cast. Notice there is no ulnar deviation of the fingers. There's no ulnar deviation of the fingers, right? Cup holding or glass holding, Dr. Strange, it could be. It's very strange that you are saying it cup holding. At your age, you should have been saying mug holding, beer mug holding. Fine. So you see, glass holding cast was the option. So it was fracture scaphoid. It was fracture scaphoid. So I believe that this was the second question. This was the second question from the upper limb topic, right? Dr. Singh, is it really is it really cup for you? No, I don't believe it. No, I don't believe it. Yes. So in the knee, there was a question. In the knee joint, there was a question. And what did they show? They did show that there was a fracture of patella. And they did show that there was a displaced fracture. The image was shown. It showed displaced two-part fracture. It did show displaced transverse fracture of the patella. Remember, we discussed all the managements there. Undisplaced fracture. Remember, we had to use cylinder cast. I'll come to the point. I know that I did not give the right answer while I was there in the class. I did not give the exact answer, right? You see, for the transverse fracture which was displaced, I used the word tension band wiring, and I did show you this image also. I know. I did show you this image which you can see on the screen, and this image also which I did show you on the screen. Fine. Now you see, the first option there was cylinder cast, or at least cast and immobilization. That is what they wrote in the first option. The second option, I believe they wrote as K-wire. Third option, I believe it was partial patelectomy. Fourth option, I believe it was total patelectomy. Total patelectomy. Yes. Two big images were there. Now you see, it's a displaced fracture like this. So we had to do tension band wiring. Fine. Now, if it would have been a fracture like this, we would have gone in for total patelectomy. If it would have been a fracture like this, we could have gone in for partial patelectomy. Fine. But since it was two-part fracture, bone was fractured into two parts. So I believe we could have gone in for the option K-wire fixation. K-wire fixation and immobilization could have been the right answer. Dr. Vishnu, can you recall the third and fourth option which they had? First was definitely immobilization. Second was K-wire. Third and fourth option, I believe they did mention patelectomy. Can anyone else please confirm which other option were there? In the patella fracture, they did show an X-ray with patella fracture, and it was a displaced fracture. One option was there, patelectomy. I've got it from at least 4 or 5 students that patelectomy was there in the option. Only 2 parts. Exactly, it was there. Fine. So we'll go in for K-wire here as the answer. K-wire will be the answer there. Let's see what were the other question. Now this has been their favorite topic for last 4 years. This has been their favorite topic. GCT. We discussed in the class that this has been their favorite topic. Giant cell tumor, osteoclastoma. I did show you this image. Remember we discussed E. Fine. Eccentric, epiphyseal location, eggshell calcification, en bloc excision, the treatment, osteoclastoma. They did show you this image. And if you see, if you can recall in the bone tumor these 4 E's, there's no point you can mark wrong. I believe this question you all must have got correct. Dr. Strange, Dr. Vishnu, Dr. Sanjeev ji, I hope you got this correct. Yeah, image could be different. I mean, this thing, no one can mark wrong. Dr. Prashant, don't retract the message, buddy. You know, I'm open to criticism. If you want to say something, please do. You see, no one can be perfect all the time. Yes. So this question was there. In the management of club foot. You see, I did not remove the ink annotation because we told you that club foot in India is the most common congenital orthopedic disorder. Club foot. You know, world over, the most common congenital orthopedic disorder is DDH. Fine. Osteochondroma could not be the option. Osteochondroma could not be the right option. You know, osteochondroma would appear like a stalk, would appear like a small tree. Fine. Okay. Now, remember what we discussed in the management. See, that is why I keep on requesting you guys to please see my PPT at least once before examination. At least once. You know, I just give you 12-13 PPTs, and only thing I demand from you guys is just 24 minutes of yours. Only 2 minutes it will take to watch the PPT. Now for NEET PG, you all will be through in the examination. In the NEET PG, please take 24 minutes out and watch the 12 PPTs which I share with you. Fine. You know, why did I say this? Because, you know, in this PPT, they have mentioned about the CTEV. Now, see this. Check the PPTs which you have. Serial casting is mentioned there. Serial casting is mentioned at the treatment. If the child presents to you, the treatment is serial casting. You apply serial cast. I did share with everyone. I did share all my PPTs with everyone. Everyone has it. Those who has been in touch with me, even for 1 minute, I did share my PPTs. Okay, Dr. Prashad. Right. You see here, Dennis Brown splint. So after the serial casting, you have to use Dennis Brown splint. Fine. And then you have to use special CTEV shoes. Right. Now, you see this PPT. So if the patient comes to you and the patient is less than 3 years of age, you just have to use soft tissue release operation. By 4 to 8 years of age, you have to use osteotomy. And then when the patient is 10 years of age, you have to do triple arthrodesis. Triple arthrodesis is only done when the child is 10 years of age. The child is newborn, has been brought to your clinic. Mother has brought that, see, the child is born like this. The problem is that the disease is bilateral. So mother will come running to you that, doctor, the child is born like this. Please manage something. So you will apply the cast immediately. Triple arthrodesis is done only when the child is 10 years of age. Right? So this question was very well there, and there's no point that you can miss this topic. Okay. Now see this. Now, can any one of you ever think of missing this image, what you can see on the screen? Nobody. And when I asked this in the questions in the examination, everybody could answer this image correctly, that this is bamboo spine. This is bamboo spine. See, just to cover the risk, we went a step ahead. We went a step ahead and we discussed these two signs also. Dagger sign. If you see this white line in the middle, this is dagger sign. If you see this. If you see white line here, both. Fine. So you see this would be trolley track sign. Fine. Railroad sign, if you see white line on the sides. We did discuss this. Ankylosing spondylitis. Dr. Dinkar, the option there were soft tissue release, osteotomy, triple orthodesis, cast. Dr. Dinkar, see, the fourth option, cast, is there. So the answer here would be cast only. Dr. Vishnu, I'm coming to that image only. So first, I believe you must have got this answer correct, that this was indeed bamboo spine. The fusion of vertebra, as you see in ankylosing spondylitis. Yes, this one, I believe that you have seen this image so many times that you cannot mark these images wrong. I believe ortho questions were simple. We pray, every time we pray that the question, they come out simple only. Giant cell tumor, you could not get wrong. Ankylosing spondylitis, there's no chance of getting it wrong, right? Now, not wasting too much of your time, we'll move to the next question there. Yes. This image is there in the PPTs which I've shared with you. Now, this exact image was not there, but the X-ray which they presented was exactly similar. Am I right? This is what you see in the tuberculosis. You see. See this. So what I've seen is that the image was like this. Right? So that is tuberculosis. So the answer in that case is tuberculosis. Exact image with the destruction of the intervertebral disc and a deformity. Knuckle, then the next is gibbous, and then frank kyphosis. Pot spine, see buddy, Dr. Vishnu, pot spine was the answer, tuberculosis. Fine. Spondylitis would have caused straightening. It would not have caused such kind of deformity. It causes bending at the level of cervical spine. But there, below it will cause straightening. Dr. Strange will come to that cervical spine X-ray question. There. We'll come to that cervical spine X-ray question also. Oh, okay. Now, 10 more minutes, and then we'll discuss whatever little question we could gather on surgery. Yes. So I believe when ma'am ended the topic, this was the question which she was discussing. What is the ideal advice you will give to the patient before any surgery? Nil per oral up to sufficient time. If you think that there were different options, please do correct me immediately. Fine. Sufficient time. This word sufficient time is actually vague. Fine. So plus minus. Advice to eat in the evening before surgery. Eating in the evening would be too long a time. The surgery is going to happen next morning. And if the surgeon is like me, the surgery will start at 10 or 11 in the morning. Fine. Drink only water. You see, clear liquids can be given 2 to 4 hours before surgery, but they are best avoided. NPO 8 to 12 hours before OT. Now this one seems to be a balanced option, so I'll go with this option. Same. Basically, any type of surgery, we prefer nil per oral at least 8 to 12 hours. See, in the laparoscopic surgery, remember, in the laparoscopic surgery, we put the Ryle's tube, that is nasogastric tube, to decompress the stomach. So 8 to 12 hours of fasting is necessary. 8 to 12 hour fasting is necessary. Dr. Kavya Bete, even if it is laparoscopic surgery, the principles are same. The only thing is that in laparoscopic surgery, we put Ryle's tube and we put Foley's catheter also. So even if it is lap, the option is same. Sir.
I'll also listen.
Sir. So I can never drive the car while my father is sitting with me, because I learned driving from my father only. So do you think I'll be able to speak properly when sir is sitting?
Arey nahi sir. I just came to
Absolutely.
first time I'm sitting with sir. Okay, and sir notes are very precise. So that's why I just wanted to see sir. Okay. Sir.
So patient went unconscious after giving intercostal nerve block, diagnosed as local anesthesia toxicity. So, I had this clear option that we will be giving normal saline because we have to maintain the hydration. But there was an anesthetist, he said that patient could be, hypoglycemic. So he said that we can go in for 20% dextrose. But in my humble opinion, this has to be normal saline only.
It's basically, so it's most likely it's because of LA induced shock.
Xylocaine induced.
So I think we can go for this.
Normal saline only.
Yeah,
Sir. Normal saline only. So basically this will be similar to anaphylactic shock there. Fine. So we'll go in for normal saline. Anaphylactic shock. We have to give anaphylactic shock is basically, distributive kind of shock. So we will be giving normal saline only. Only thing has got confused. I would like to name the anesthetist. He's a big shot, sir. He said that 20% dextrose could be the option. But he was, but we will go in for normal saline as the option because this patient is of distributive shock. Fine. These were not the option, Dr. Body.
Not the NS?
He said they were not the option.
Maybe they just dextrose was the
20% lipid emulsion. Okay. Then this option is of course definitely wrong. So normal saline is answer. Dr. Kavya, there's a doubt there, but we believe that this patient is suffering from anaphylactic shock. So we'll go in for normal saline as the right option there. If you read in the treatment of anaphylactic shock, we go in for IV fluids there. We have to give over and above the no. 5% dextrose we cannot give. 5% dextrose is a hypotonic fluid. We cannot give that. We'll have to give normal saline because we want to raise the blood pressure of the patient.
Yes.
5% dextrose will be quickly absorbed and then the solution will be hypotonic. That's of no use.
See, there's so many is
Anaphylactic
shock following denoking. So there's so many cases. It's most likely.
So we'll go in for normal saline here as the option there. Okay, then that will be discussed. Don't worry. Now, I believe in the given image, which of the following is the type 3 of the choledochal cyst? Now, all of those who have my PPT, remember, I did share about the Todani classification, Alonso-Les classification as modified by Todani. And if you go through your note, we discuss the individual treatment. For all of these type of cysts. I still remember that, yes, I did said that type 1 is the most common and it is the most important. But later, in the class only I got corrected that, yes, we can at least see type 2, 3, 4 type of cyst. And in the exam, probably it was type 3 cyst, choledococele. So there was a cyst in the duodenum. Remember, earlier they used to do duodenotomy for it. Now they do sphincterotomy for it because now we are doing it endoscopically. And this question I think that this was the one which was based on ERCP.
So, in case it is a LA-induced cardiotoxicity, which is causing the shock because it blocked the sodium channel, then we can use a lipid emulsion as an antidote. If they are giving maybe lipid emulsion, they
Was the
can
cardiotoxicity mentioned there? It was just mentioned shocks after that.
some are saying the lipid emulsion was in the
20%
option.
lipid emulsion was there in the option.
Can be used as an antidote if it is a cardiotoxicity.
The screen is frozen or it's working?
No, it's working. Just move.
3 type of images were there, na? So you had to choose. You see, 1, 2, and 3. You had to see what type was there. So the cardio was not mentioned there.
Yeah, then we should go.
Then it is a normal saline only. So type 3, choledochal cyst. Yes, definitely. Now see this. This was mentioned there that a patient has testicular pain and he is there in the OPD. On examination, it was found that his left scrotum is lower than the normal. Okay. Now, if you read only up to this point, then the answer would have been epididymmo or chitis. You see, because the left testis is lower than normal. If the affected testis is higher than normal, then the answer is torsion. But here you see that they did mention bag of worms. They did mention bag of worms. Because they mentioned bag of worms, automatically varicocele is the answer. Varicocele is the answer. See, the other option was, the patient could be having hydrocele, but in the hydrocele, the swelling would be transilluminant, and there would be no pain. In varicocele, there is dragging sensation, which is similar to pain, Then that's a different question probably. If Dr. Body, Dr. Health is correct, that for local anesthesia toxicity, option were 5% lipid emulsion, 20% lipid emulsion, 5% dextrose, 20% dextrose, then I believe 20% lipid emulsion would be the answer. Yes, definitely varicocele. Now, this is the question on which, we did spend at least half an hour. Discussing. And, one of my senior resident, Dr. Pavan. Now, he happens to be a gastrosurgeon. So we did even call him because, there was some confusion on this. So this is a bariatric surgery, biliopancreatic diversion. Fine. So we discussed all the options. Now listen to me and then I'll give you the right answer. Listen to me. Why are we ruling out everything? See, this patient answer you see is vitamin D deficiency. I'll tell you why. Fine. Protein and calorie malnutrition cannot be there because the patient will be drinking high calorie fluids. Fine. Can drink high calorie fluids. Now, he will drink high calorie fluids. He will have more severe diarrhea. So slowly his body will adjust, but he won't have protein and calorie malnutrition. C, calcium deficiency. I'll share some of the screenshot from NCBI, PubMed. We did gather this data. Now, you see, remember 1% of the body calcium is in blood. 99% is in the muscles and the bone. Now, vitamin A is a fat-soluble deficiency. Is a fat-soluble vitamin? Yes, deficiency does occur. Vitamin D deficiency is seen in 30 to 70% of the patient. And clinically significant calcium deficiency is seen in less than 10% of the patient. Less than 10% of the patients. Fine. Now you see here, duodenum is the main site of absorption of calcium. Yes, this can cause calcium deficiency. But the problem here that in this type of surgery, bile does not get to mix with food. So there will be deficiency of fat soluble vitamin. We did check it from multiple sources. Fine. Three of my, colleagues, they were of the opinion that, sir, calcium should be the answer. Three were of the opinion that, sir, vitamin D should be the answer. Fine. And my vote was tilting towards vitamin D. Then we did discuss it with two prominent gastrosurgeons, and they were also of the opinion that this is going to be vitamin D. They did even share the PubMed screenshot. I'll share them in the group. Fine. So here answer would be vitamin D and certainly not calcium. Copper deficiency is not there. No. Copper deficiency is not there. Vitamin D is the answer, and you have marked it correct. A 70-year-old patient with a high blood pressure around 120 was presented to the hospital, who is a known case of coronary heart disease. Which blood vessel can be used as a graft for longevity of the patient? Now, internal thoracic is the most common vessel used. Internal thoracic is the most common vessel used. Internal thoracic. How many of you marked some other option there? अरे डॉक्टर पद्मराज जी, मैम गए. So if you have to choose in these options, then we have to go in for internal thoracic. Yes, you can use saphenous vein. You can use saphenous vein. Yeah. Okay, so this question was also controversial. I did talk to some of the orthopedic residents there. Now, when I was talking to the orthopedic resident doctors, those who have academic bent of mind. Now, when I did give them this question, saphenous vein, if the saphenous vein was there, we'll go in for saphenous vein then. Yes, if saphenous vein is there, we'll go in for saphenous vein. No, so these were, now remember, this was a 3-day-old wound. Now, because of this 3-day-old wound, we'll go in for amputation. 3-day-old wound. Debridement and fasciotomy. If fasciotomy would not have been there in the option, fine, we would have gone in for debridement. Fine. Now, it was a 3-day-old wound, so we preferred amputation. But you see, there is a catch. Now, if you see the feet, it is still showing, after 3 days, there are no signs of gangrene. That means the vascularity is preserved. Fine. Vascularity is preserved. So, if this was the exact image, that vascularity of the feet is preserved, debridement would be the option. Yes, if debridement would be the option. But if the vascularity is not there, because I have not seen the exact image there, we feel that this was very close. This image was very close. Primary closure is not done. Now, let's see. Now, I'll write them, the options, and you see. Amputation can be done. Debridement and primary closure should not be done. Hyperbaric oxygen therapy alone is not sufficient. Closed plaster, not done. They did not show. In that case, it is the amputation. In that case, the clear answer is amputation, because it is a 3-day-old wound. You cannot do anything there. In that case, amputation is the preferred answer. Vertical image up to knee only. So that means we will go in for amputation as the answer. We'll go in for amputation as the answer. Now this, I want to open one image in front of you. Why do I say that reading PPTs is important? Why do I keep on saying that reading PPTs is important? Amputation with closed wound. You can do amputation, but here you will not close the wound. Here you will not close the wound. Here you will not close the wound. Okay. See, the options are not clear. That's why the confusion remains. That's why I keep on saying that reading the PPTs is important. You have the videos. If you have the surgeries videos, remember I told you that these are the landmarks. C5 to T1, 2, 3, 4, second, third and fourth tracheal ring. Second, third and fourth tracheal ring. See, this thing, the thyroid cartilage lies between C4 and C5, lies between C4 and C5. And this was the question which they asked. This was the question which they asked. C1, C2, C3, C4. So this is between C3 and C4. That is correct. Now there are two options. At the level of upper border of thyroid cartilage, at the level of upper border of thyroid cartilage. Fine. At the level of lower border of thyroid cartilage, because after C4 will come C5 and then the thyroid gland will start. So this C is the right answer. C is the right answer. Upper or lower, yahi to confusion hai. That is the confusion. Thyroid cartilage lies between C4 and C5. C4 and C5. C4 and C5. So C3 and C4. So C4 is about to start there. So in that case, it would be the upper border. I'm really sorry. So this would be the upper border. Upper border. Yes, you're right. Countable cervical. So you see, if let's say C1, 2, 3, 4. Now here, between C4 to C5 would lie the thyroid cartilage. Fine. So this would be the upper border. I stand corrected. It is upper border only. It is upper border. Indeed, it is upper border. A patient underwent surgery of submandibular gland during which a suspected injury of the hypoglossal. The word is hypoglossal. Below the tongue. I'm really sorry, Dr. Vikas. No. It's not the lower border. It is C4. It is the upper border. I stand corrected. I stand corrected. Hypoglossal. That means below the tongue. Fine. So you see all the muscles, extrinsic and intrinsic, will be paralyzed. So what will happen? Ipsilateral twisting of the tongue. Ipsilateral deviation of the tongue. So there will be deviation of the tongue on the same side of the lesion. Which other nerve can be injured? Remember, it could be the lingual nerve which can be injured. And that would cause loss of taste sensation. Fine. Loss of taste sensation. freely mobile breast lump. I believe there is no doubt here that this was a fibroadenoma. This was a fibroadenoma. Fibroadenoma. GCS question. We did read so much of GCS, and this is the question which they asked. Remember, minor brain injury, GCS 15. Mild brain injury, GCS 13 to 14. Moderate brain injury, 9 to 12. And severe, 8 or less than 8. 8 or less than 8. Breast mouse is, fibroadenoma only, freely mobile. So here, I believe they gave 10 as the GCS score of the patient. 10 as the GCS score of the patient. So if it is 10, your patient definitely has moderate brain injury. Moderate brain injury. Pneumothorax. Remember, we saw so many images of pneumothorax in the PPT, in the exam, in the class, in the rapid revision, in the test and discussion, in the questions which I gave you. So you see this is all full of air, and this is the collapsed lung. So even then it is moderate. Dr. Muhammad has asked G. Even then it is moderate. Even then it is moderate. Even then it is moderate. No, 13 and 14 is mild. You see, this is pneumothorax, and you see this, the lungs, collapsed lung. Pneumothorax was there in the question. See, whether it is 10 or 12 doesn't make any difference. Pre-op preparation about the hair. So it was clipping. And clipping has to be done on the table, not before night, not 1 hour before the surgery, 2 hours before the surgery. Has to be done on the table. We don't use razors at all. Remember, the razors, they cause micro abrasions. Razors, they cause micro abrasions. Fine. What is the best time to give the antibiotics? It is within 1 hour of surgery. Fine. So preoperatively, we do the clipping. Preoperatively, we do the clipping. Now, because there was a confusion, kindly allow me to explain this once again. You see here, this cartilage, thyroid cartilage, lies between C4 to C5. C4 to C5. Since they are showing between C3 and C4, so we will go in with the upper border. We'll go in with the upper border. Right? So if you don't remember anatomy, at least you remember surgery. The thyroid gland, the most important endocrine gland of the body, the most superficial endocrine gland of the body, the biggest endocrine gland of the body, lies between C5 to T1. So if you don't remember the anatomy, you can always remember surgery. Dr. Raj, no, it will not contaminate. It will not contaminate, certainly, because you are contaminating. Okay, let it be that you are throwing all the hairs here and there, but you are at least not contaminating the skin of the patient by giving microabrasion with razors. Yes. So as and when more questions come, we will keep on discussing. We will keep on discussing them. Fine. We'll have another session, and then we'll keep on discussing more of the questions. So you are requested to share as many questions as possible. Rakshipu, is that okay? Okay. So I'm done with the question which I had. Maybe sir would like to have a word with the students. Yes, sir.
I join you, sir. एक बार क्लास मैसेज कर देते हैं बच्चों के लिए, क्या टीचर लिख लेते हैं आप?
Sure.
अरे पर उसको बुला ले, सारा बोलो।
अरे सर, आपके सामने बड़ी
अरे सर, ऐसी बातें मत किया करो। चलो, ओके, हेलो गाइस, आई होप यू आर डूइंग वेल। कोई दिक्कत नहीं सर, एक अनलॉक करो। सो I hope
Herceptin
everything is
2,
fine.
the answer is transducer. I'm sorry, sir.
हाँ sir. एक फोन एक ले लो.
Cast is the answer.
ये लो आप.
Leak of cystic duct was asked that on the third day, so you just have to do the drainage. Remember, we did discuss it when we were discussing the complication of laparoscopic surgery. Have fun, Dr. Bingo. Have fun. Come to us.
बिंगो मैजिक मस्ती ने कहा उस चांद को गरूर है उसके पास नूर है, उस चांद को गरूर है उसके पास नूर है, पर उसे क्या पता हमारे एफएमजी को ही नूर है।
एक गाना सुना दे. बच्चे तरस रहे होंगे. पारस आया और
जिंदगी एक सफर है सुहाना, यह कल क्या हो किसने जाना। जिंदगी एक सफर है सुहाना, यह कल क्या हो किसने जाना। दोस्तों आज ही आज मौजे करो, जब तक रिजल्ट नहीं आता जी फाड़ के घूमो, मजे करो, कोई टेंशन नहीं है। जबकि जब देखी जाएगी वो रिजल्ट अच्छा ही आने वाला है, ठीक है ना, समझ रहे हो, तुम्हारे साथ ऊपर वाला है यार, क्या टेंशन लेते हो तुम। ऐसे कैसे है कि
मीम्स बनाओ सर.
सर ने तगड़े तगड़े निमोनिक बना रखे हैं
सर. मतलब कौन सी खलीफा जी का बना.
तो मैं जो सर ने ना एक जिस दिन एग्जाम देने गए थे, सर ने मतलब खाना खाया तो कहते थोड़ी भूख है, उसके बाद मैंने ना एक स्पेशल चाप मंगवाई, सर ने 4-5 रोटियां खा दी और चाप भी चाट के खा दी। पूछो कौन सी वाली चाप थी, उस चाप का नाम था मियां खलीफा चाप। भाई चाट के खाया, पूरा पतीला चाट दिया आदमी ने, मियां खलीफा नाम।
चलो ओके. तो ये डंपिंग सर करा दे. डंपिंग वाला क्वेश्चन.
डब्ल्यूसी वाला क्वेश्चन इन्होंने अभी पूछा कि उसमें
अच्छा.
एमोक्सिफेन के साथ कौन सा कैंसर होगा।
So, एंडोमेट्रियल बोला है मैम ने, तो विल गो फॉर एंडोमेट्रियल. ये चैंटिंग नोट्स में भी है शायद तेरे. या इट्स अ रिसेप्टर मॉड्यूलेटर ना एस्ट्रोजन, सो इट विल बी अ यस कॉजिंग दैट. और क्या ये डंपिंग वाला
गैस अंडर द परफोरेशन, देखो भी दीस आर टेल टेल थिंग्स। आई मीन वंस यू आर इनटू सर्जरी, एक बार भी आपने सर्जरी पढ़ लिया, एक्सरे पढ़ लिया, रेडियोलॉजी की क्लास ले ली, एयर अंडर द डायफ्राम कुपोला साइन, दैट इज अ टेल टेल साइन, यू कैन नॉट मिस इट, नॉट मिस इट। एयर अंडर द डायफ्राम, उसमें तो मिस करने का चांस ही नहीं है।
गुनाह है, गुनाह और इस गुनाह की कोई सजा भी नहीं. ओके
या बड़ी डॉक्टर दीपिका।
या सो यस सर ने अपना पूरा एफर्ट दिया है, एंड आई थिंक वी हैव कवर्ड मोर देन 100 MCQs इन दिस सेशन. मोर विल बी अपडेटेड सून, एंड आई डोंट थिंक कि देयर इज एनी डाउट दैट यू आर ऑल गोइंग टू क्लियर द एग्जाम एंड पास. ओके, so yeah, so we are all going to do. Okay, and I'll just show you some more questions which were there. Okay, then we'll wrap up the session. Okay, so I'll just show you.
The screen will be blank for a while.
सर पूरा बता देते बाबा.
एकदम से डर जाते हैं.
नो सिग्नल. अरे अच्छा है ना, तब तक हम ACBC करते रहेंगे जब तक है जहाँ. Is it taking this output? क्या बात है. Yeah, you're all going to pass. Okay. Yeah, you can recall questions. Very, very good. Okay.
Dr. Shiro, the mobile lump is fibro adenoma, breast mouse.
Yeah. Fibro adenoma. Yeah. Is it showing, Dr. Shivu? The second screen. Can you check? A duplicate. Yeah, I've duplicated. Just check.
जिए तो जिए कैसे बिन आप
You do it from here, okay? So we're just yeah. No, sir, आपको करो.
What was the question on Herceptin 2? About the prognosis.
आ रही सर?
Where's the okay.
अच्छा स्क्रीन आ रही. Okay.
Okay.
मेरी आ रही है. चलो. ये चेंज करा दे, इसको चेंज करा दे. अच्छा, डायबिटिक वाला जो है क्वेश्चन सर देखो, ये आई थिंक डायबिटिक वाला क्वेश्चन बस डिस्कस ऑलरेडी.
Hello. Hello.
If there's infection, you can always have discharge present, okay, and that is covered.
And
Dry
second
is
to-
coagulative.
Sure,
If
sir.
it's wet, it is always liquefaction because of enzymes which break down and create this wetting. That will. All बताओ. Okay. Both legs wetting. So I'll keep showing the questions. You tell me you got the dead tissue show dystrophic, D for dead, and more calcium is metastatic. So that I discussed. So vitamin D, PTH, paraneoplastic, they all will cause what? The metastatic calcification. Atherosclerosis will be causing what? The dystrophic. I took this session in the pathology rapid division. It was again covered up. Okay. Then there's a question on cyclins. What they do? They regulate the cell cyclin. Okay. And they are the ones G1, S, and M. And you know, at G1 everything double. At S DNA double. Then G2 is error checking. Like G2 हमारा क्या करता है? Error check करता है.
Yes,
तो याद करना G2 error checking करता है. And then after G2 is clear, the cell will undergo mitosis and double. Okay. We discuss all this. So breast में पूछा था क्या ये abscess?
Prognosis, prognosis with Herceptin 2 new tumor is very, very bad, but it has vastly improved after trastuzumab. So if you give trastuzumab, and if it was given in the question, prognosis is okay, not so bad. But otherwise, prognosis with Herceptin 2 new is very, very bad. Because, Herceptin 2 new tumors, they are very aggressive, they divide very rapidly.
Yes.
Fine, Ki67 levels are also very high.
Yes.
So prognosis is definitely bad.
Image question on type 3 cystic. Sir, आपने करा
ये
दिया.
कराया था, sir.
Sir has already discussed that. Bingo,
We
this
discussed it.
question was already.
Choledococele.
So yes, all these questions were there. Okay. Sir, वाला ABCD वाला भी क्वेश्चन आया था. Airway, breathing, circulation, disability. That was also a question.
उसमें D वाला पूछा था कि disability assessment. How to do disability assessment with the digital rectal examination? D for digital rectal examination and D for disability. We discuss it with the help of GCS, Glasgow Coma Scale.
उसके अंदर वो आया था moderate वाला.
So,
So all these
moderate वाले में
questions
आया
were
था,
there. And see, this question came कि what is for cleft palate, cleft lip, or this anencephaly? It is polygenic inheritance. So it was, yes, multifactorial. It's again an exam question. So I just show the questions. Yeah, allergy. So remember this one video of hypersensitivity. 3 questions were there. One was allergy by insects or IG type 1 hypersensitivity. Then the type 2 are pneumonic. My blood group is Rh positive. Myasthenia gravis, blood transfusion, Bush pasture, Graves, ITP, Rh incompatibility. Okay, these are. And myasthenia gravis was again a question of type 2 hypersensitivity. Question was there that delayed chronic graft rejection. So chronic graft rejection is a type of what? It is delayed hypersensitivity. It is delayed. Okay. So staging of glioblastoma. It's an ortho question also. It will be covered there also. It's a surgery question also. Even this topic of ENT and medicine. So again, this question was there. Delayed is type. So type 4 is delayed. Voice is not clear. But
तभी आ रही थी आवाज, पहले मैं दूर रख दिया था.
so okay. So this was there. Okay, I think yeah. Cell involved is T cell. If it is chronic, it is T cell. Okay. If it is acute, okay, then it is antibody. That is B cell. Okay. Most likely it will be asphyxia. Okay. That's a decrease in oxygen level. Because when there's suffocation, 2 things: either traumatic asphyxia because people are crushing each other, they cannot breathe, that causes a type 2 respiratory failure, and that is called the death. And or there's a decreased oxygen level in the air because so many people breathing will produce too much carbon dioxide and decrease the oxygen level. So these 2 are the main things. So I think it was option was some bacterial reaction, some chemical changes, some physical changes. I think that were the options. So black hole of Kolkata was the exam question. So very old story. At the time of that Nawab of Bengal, they put British prisoners into a very small place and caused death of so many people. Yeah, the chemical reactions. Okay. Yeah.
Ventilation.
If vent is enough, then it will not cause asphyxia. Okay. Maybe some chemical change. Okay. See, bacterial infection was not the cause of death. The people, when they are got out, lots of people died. So it cannot be bacterial infection. Infection से यार मरेंगे तो टाइम लगे, एकदम से ना मर जाएंगे यार. ठीक है. चलो. So I'll just keep showing the question till then. Okay, ये आया हमारा. फिर ये क्वेश्चन आया था हमारा MMR. मैम ने डिस्कस कराया MMR is 6 weeks. That is 42 days. 6 weeks or 42 days or 6 weeks. Okay. Then this question came primary, secondary. All investigations, screening is secondary prevention. Counseling or health promotion, specific protection is what? Primary prevention. Question was there. Okay. D is for disability. Then this question was there. Impairment is what? It's loss of limb. Again, it was taken by PSM rapid revision on 15th of August. So loss of limb, anatomy, physio is what? It's impairment. Then question was there on Daly, Quell and Hale. Again, we discussed that already. There is a question when there is a decrease birth rate and there is what? Death rate more than birth rate. That is a decline phase. So again, this question was discussed already in PSM revision on 15th August. You can see. So I took it on live. Okay. So again, this question, HDI, rich country use for this. This question was also asked. HDI use for rich country comparison. HDI. So again, this question. Okay. Then there is a question on outlier. See, if outlier, take median. I mentioned clearly this is an outlier, we should take median. Okay, clear? CBNAT will be a secondary because you are diagnosing the tuberculosis, will be a secondary prevention. Okay, so again, this question was there. Yeah, Europe will use HDI. Okay, see, I have discussed this question also. Don't worry. Okay, BGMI I will discuss all. So this answer is median. Then, if there is a line curve, it will show the trend which is either moving up and down. Okay, so Britain is obviously in decline then. Okay, चलो आगे देखते हैं. एक ये क्वेश्चन था, BCG is at birth 6, then DPT. So BCG is only at birth 0. Discuss that in again PSM revision. The single revision of 4 hours covered at least 12 questions.
True, sir.
Yeah, cohort, relative risk. Cohort we use for relative risk. Again, PSM lecture YouTube. Okay. Again, one more question there. Vaccination 0 week. Yeah, some question was there in pediatrics about the handed approach. I think double-handed or single. I don't know exactly. If you can remember, you can just give me the question. Okay, there was a question. Okay. Then there was a question on acute severe malnutrition. So 3 criteria are bilateral edema, the mid-arm circumference less than 11 point, and the weight for height 3 SD or less. It is for acute severe malnutrition. Acute. This question of echolalia was exactly, see, edema is kwashiorkor. O edema, O kwashiorkor. We discussed that also. Edema, kwashiorkor. Again, pediatrics rapid revision 17th May 2022. Then motor, see, copy examiner speech. What is your name? What is your name? Even in the chanting we discussed this point. Echolalia is copy examiner speech and praxia is action. So that is the case. Okay, so copy examiner speech. This was also discussed. Then drug of choice for bipolar, lithium is the mood stabilizer. Lithium is the mood stabilizer. Okay, lithium. So there were other questions also, like there is what? Persistent thought, obsession of hand dirty, keep watching, OCD. So we have discussed so many questions. Okay, I have shown you more than 100 questions but just from rapid revision plus chanting 100 questions.
True, sir.
Nitin sir covered more than 40 questions in just surgery. So if you take this, they will cover more than 200. Do some overlap also. So 200 to 220 questions can be solved easily by this. Okay.
ये भी क्वेश्चन था सर कि वो उन्होंने ट्राइकोबिजोर का इमेज
हाँ,
दिखाया
ट्राइकोबिजोर.
naturally because the patient is going to be psychologically unstable. So besides surgeon, you will have to ask the patient to go and visit a psychiatrist also.
Yeah.
Yes, definitely.
Yes,
Many of you must have marked it correct. In fact, all of you must have marked it correct about the psychiatrist.
Okay. So I'll be posting detailed description of all these questions. Medicine questions, they are still there. Like which drug is used? See, legionnaire disease, that is atypical pneumonia. What is the drug of choice? Azithromycin. This is in the pharma revision I took. Azithro is for Legionella. Can you see this? So drug of choice for atypical pneumonia, Legionella, is azithromycin. So this I already discussed. Then there was a question on brain tumor, ileum, urine, 5-HIA being elevated, diagnosed carcinoid. Again, this was discussed by this. So I posted this question, Dr. Ashish Kumar, ki if there is the increase 5-HHA, which is the tumor carcinoid. So again, we discussed this question even in the question form also. It is the explanation of the carcinoid tumor. So unstable angina, and we give 325 milligram aspirin. What is the mechanism of action of aspirin in this case? It's an antiplatelet drug. This again we discuss here. So Mona we give in case of MI, acute MI, and we have aspirin, which is an antiplatelet, prevent the clot formation because the platelet cause a temporary hemostatic plug. That is prevented by plate. So it's aspirin, okay? So discuss that already, okay?
Then says at least 121 plus 120 plus question was
yeah
from the chat.
Yeah, 120 was from chanting, rapping and all, okay? See, which of the following is not used in non-STMI? We don't use streptokinase. Remember, thrombolysis is not done for non-STMI. Remember the Mona and Sonam or S-Mona? Yeah, Mona. So ये है आपका. So that's why in no if ECD changes, that is non-STMI, and we will do no thrombolysis. Only Mona is given, no thrombolysis. We can do a delayed PCI angioplasty, but not the immediate.
Mona and sweet Mona.
Sweet Mona? Yeah, Mona, Sona.
Mona, sweet Mona.
See, this was there on my cardiology class, okay? So then this question was there. Ki diabetic patients brought and his BP is low. See, the answer is drug of choice is insulin, but if there's a hypotension, we'll first give the fluids, then we'll start the insulin. So the answer will be IV fluids. Again, I discussed this. So देखो, ये diabetic ketosis है. There is a acidosis. There's low bicarb, sweet smell because of the acetone. And first is start normal saline, and then we add insulin to the normal saline itself, and that was the answer. Okay. See, again, non-STMI will use treatment is Mona, morphine, oxygen, nitrates in the form of nitroglycerin IV we can give, and aspirin, okay? Then diabetes mellitus, hyperglycemia, necrolytic migratory edema. It's a classical feature of what? Yes, it is seen in case of your, yes, endocrine tumors, which are mainly affecting the GIT, called as what? Pancreatic neuroendocrine tumor, which include all these tumors, insuloma, VIPoma. But if they are mentioning diabetes like features, so obviously insulin will decrease the glucose, and lack of insulin causes what? Diabetes. Here it is an insulinoma, so it cannot be A. So obviously it will be glucagon, which causes hyperglycemia, diabetes like condition. So you can solve it in the base of that also.
In the test and discussion which we took in the last rapid revision, I did ask a clinical based question on VIPoma. So in that I discussed these three tumors.
Yeah, so sir already covered this topic. So I think directly it is covered here or there, always and always, okay? Then there's a question on, a person is collapsed and you're giving CPR, rescue team come, what should we do? So obviously you cannot say कि अच्छा भाई चलो मैं चलता हूँ, ये लोग संभाल लेंगे. You have to continue CPR and let them start the, defibrillation, and they will apply the paddles for defibrillation. This is what the guidelines of ACLS is. Also we discussed ki arrange for the, defibrillation, start CPR and use AED as soon as possible. So CPR should not stop. It should continue. You should just do, if shockable rhythm, we should give the DC shock and try to, defibrillate, okay? Young adult with gastric outlet obstruction, vomiting. So obviously it is a acid loss causing what? Metabolic alkalosis. And in metabolic alkalosis, there's no point giving ringer lactate. It will rather worsen the condition. We'll go for normal saline. So again, this question was discussed. What is the vomiting cause? It causes metabolic alkalosis with hypochloremia. The fluid of choice will be normal saline, not ringer lactate. All these questions were covered by the medicine RR. J wave is seen in, okay? So not covered in medicine RR, but in regular class, that it is seen, it's called as Osborne wave. And it is seen in hypothermia. They even give a history of some water drowning, etc. So this is the Osborne wave. It's a part of my ECG notes, sir. Hypernatremia. So Osborne wave. So we covered almost everything, okay? So anyone saying कि sir medicine sufficient as surgery, यार आप class को लगाओ, you study and then judge ना. So in fact all other like this, which drug should not be used in emergency? Again, this I discussed. In case of hypertension, all even this Ras-Buricase is used for tumor lysis syndrome. This is my pharma review notes. Ras-Buricase is for hyperuricemia due to anti-cancer drug, that's tumor lysis syndrome. So I think all this sweating is absent in case of what? Heat stroke. There's a one very peculiar feature. So I think we'll wrap the session up. We'll post it later, okay?
True.
And there's no point discussing all because we can prove.
What's this question?
Reynolds question. Reynolds question was there. So you can use a CCB. Even alpha blocker can be used. Prazosin can also be used, but main drug of choice will be CCB.
That's one more surgery question. I'll take the credit for it.
Yeah, surgery question. So that's what I'm saying, ना कि overlap करेंगे 200 plus. So I think people who are there till the last, they can. Sir, एक question आया था ये प्रोस्टेटिक कैंसर का मार्कर क्या लोगे, 123 और 131? प्रोस्टेटिक कैंसर
131 is for treatment.
Yeah,
You know,
ablation,
for
yeah.
diagnostic investigation, it is always iodine 123.
same for thyroid also.
Sir, exactly.
Yeah, so I think it's 131 for ablation. Okay, चलो क्या बात है, 80% क्वेश्चन फ्रॉम चैंटिंग, दैट्स वेरी वेरी। सी STMI है तो मोना है, उसको देखो आंसर आपका दे चुके हैं ऑलरेडी। या सर 125 इज द आंसर।
Sir, actually there are 4 marker, 123,
सर एक आप लोग
125,
ये आप क्लियर
131
कर
and
सकते हैं।
132. See, 123 is for diagnostic investigation in case of thyroid. 131 is for treatment purpose. Other, other marker apart from 123 is 125. Fine, and then we have 132 also. If all of them were there in the option, first choice will be 125, then 123, then 132. Fine. So I believe if 125 was there in the option, we'll go in for 125.
They ask for treatments, prostate. So I think it's fine.
It was for prostate 125. So prostate also 125.
So prostate is 125.
125.
Sir,
Yeah, 125.
125. Any other doubt or queries? Okay.
Okay.
I think you people should not be afraid now. If you are able to relate, and even your guesses after studying a guess become much better. Like example, a guess of a nurse or a MBBS doctor, like let's say, what is this? He said tumor. I say I think it is a benign tumor. So a MBBS will know better. A pathologist will know even better than them. Clear? Same way a surgeon will know more than a MBBS, but a super specialist might know even more than MD. So that's why you'll always have a gray zone, which is confusing. But as you become more and more aware, the clarity is better. Like a newborn doesn't know what a car is, but a 2-year-old might say car, car. But some but older know it's a Mercedes or Maruti. Older even know which brand, BMW, Z series. So as you grow, your understanding improve.
True.
So that's why my thought is, with whatever understanding you got from our classes, you will be able to solve question better. I'm not saying all right, better than what you could have solved without any intervention from our side.
True.
Yeah, if we'll do a study on that, a case control, people taught by us, not taught by us, and we take their result, we will do a study and we can show the p-value is significant, less than 0.05. Okay, so it's a group of 30 sleeping one window. ये वही वाला क्वेश्चन है,
Same question.
सेम क्वेश्चन, वही कोलकाता वाला है, ये ब्लैक होल ऑफ कोलकाता 125। ये सारा मैम ने भी कंफर्म कर दिया है। So I think we'll wrap up the session. If anything else you want to say, please say. We are all going to say goodbye. Dr. Sara, if she is anywhere near.
Dr. Sara is around.
अरे वाह, आगे सर देखो।
सर देखो पे ये
देखो आगे ये
भी ये क्या कहते हैं
नेकेड वन, आ जाओ।
ये सर स्पॉन्सर्स हैं, ये दिल बहलाने के तरीके हैं जो अभी एग्जाम देके फ्रस्ट्रेटेड हो चुके लोग, उनके लिए जो है बड़े ही तरीके से जो है इनको जो है वो किया जाए, दिल बहला जाए। इसीलिए ये लोग क्या करते हैं, अपनी ऐड देते हैं और फ्री प्रमोशन है। मतलब हम चाहते हैं कि सबका धंधा चलता रहे। तो लव यू the people, all of you watching from the different part of India, love you to Kashmir, Punjab, Himachal, Haryana, Delhi, Rajasthan, Kanyakumari, then Kerala, Calicut, Gujarat, Manipur, Assam, Imphal, Chhattisgarh, Bihar, Uttar Pradesh, and miscellaneous people from Nepal, from Russia, from Slava, Ukraine, and China, Armenia, Moldova. All people, love you all, truck barke, and we are glad you are attending this session. And I request all of you, please go on trip यार, थोड़े मजे करके आओ, आ जाएगा रिजल्ट देखी जाएगी। सदके हैं भाई, जाओ मजे करके आओ, और कहीं जो मुलाकातें अधूरी रह गई हैं वो उनको पूरा करके आओ। बहुत दिन हो गए मजे काटे हुए। And you already know we'll publish a PYQ updated PYQ. Yeah, sure. Everything will come, सब तुम्हारे लिए है ना। Chalo, we'll wrap up the session with a proper goodbye. Good night, Das Vidanya. Love you all, Truck Barke. And I request Dr. Shibu, please stop the stream as it's high time for them also to do dinner and do miscellaneous yoga exercises. So, kya bola, yoga se hoga.